can I help?
There's well-documented evidence about what safe levels of drinking are.
I know my body. Your opinion is totally different from my experience.
Sure.
We're going to tap on the legs, and I want you to say yes when you feel me tap, OK?
Sorry.
How much are you drinking at the moment?
As much as I can. I start drinking first thing in the morning. As soon as I open my eyes, I drink till I pass out.
Are you feeling any easier?
Yeah, I feel a lot easier.
Curious, aren't you?
Barnaway Surgery, Cindy speaking, how can I help?
Hi, I've got an appointment booked for my son, flu issue.
What's up, Annie baby? You didn't bring in any chocolates?
Hello, Evelyn.
Oh,
You've been good?
Well, don't know about that.
I had to talk him out of it.
Yeah. Have a seat there.
She's not been too bad.
Ah, OK. You've been good?
Yeah, no more practising for the Olympics.
91.
Yeah, 91, runs rings round me. She's got more marbles than I have.
And though it looks red, it's not
Painful. Don't want to leave the remaining skin.
Trouble is your skin's so thin,
Yeah, I
it
know.
tears,
I do
so
know.
it's like... You'd make a great tissue.
Oh, dear.
Oh, that's lovely. Take that off. It's great.
Does it feel itchy?
At the top part.
Does it look better?
Let's have a look. It looks like the fluid is gathering at the bottom there. By the time you finish your antibiotics, yeah?
But
And
can
I
you
don't
imagine when she rang me and said, I've scratched my leg?
Oh, dear. Yeah, yeah.
It's not what I class that. Look,
You wouldn't classify that as
That's
a scratch.
a scratch.
That's a scratch.
scratch.
And tell her why. Tell her why you've got
That's...
And yeah, these are scratches from doing her garden.
Oh, did you?
It's lovely because that's the first time I've had to ask any of you to do things like that.
Yeah?
Yeah.
We intend to do things like that, but by the time we get round, you've already had done it.
Yes.
Oh, she's already done it.
Oh, she's worse than a child.
Oh, it's good to be
I know.
independent, but
But there's just really unnecessary.
you still got to look after yourself. All done?
Yeah, I'll have to get the girls to cut my toenails.
That's down to them. I don't do feet.
No, but they do that, don't they?
Yeah, they can do that. I don't.
All right.
That's my granddaughter's.
Oh, she's gonna do that.
They're beauty therapists, so they're used to feet.
Oh,
That's that's why I'm so used.
yeah, there you go, Thelma.
Well, you're such a stunner.
All done?
Yeah, you're lovely. That.
Yeah, and
Oh, how lovely. She's my friend.
Well, I'm going to leave you here then if you carry on like that.
mind that chair, mind that chair.
I know.
Yeah,
I'll
all
be
right.
careful.
Okay, we'll see you on Tuesday.
Yeah, definitely.
All right?
Thanks,
Okay.
hon. You
All
have
right
a lovely
then.
weekend.
Okay, you too. Bye-bye.
you.
Bye-bye.
Bye.
Bye. Bye.
I send apologies to you.
You apologise to
You were the first person that I blamed for that. You were. Then it was Riff. Then I found out it was Little Miss, but I wouldn't melt in her mouth.
I wouldn't do anything so infantile.
I thought it was very clever that she thinks my bits and boobs look like that.
I put the red dot in the middle afterwards.
You think the other one's inverted?
Yes. Got an inverted nipple and he's the doctor.
There we go. I'm Dr. Tawana. Nice to see you.
Nice to meet you.
How are you?
Thank you. It's unfortunately it's Louis
Seems a little unwell.
Okay.
Yeah, he's just got a temperature today.
Yeah.
37.9.
Okay.
Last time
you checked,
Yeah.
okay. We say up to 37.5 is normal.
Right.
Okay, so going up to 37.9, it could simply be that he is warmer.
Right.
And that his body just hasn't been quick to regulate his body temperature. How long has he had that kind of gentle kind of rise in his temperature?
That was this morning.
Just this morning?
Yeah.
Okay.
Also, his nappies are smelling a little bit stronger than usual, but
yeah.
only by a tad.
Okay, so and that's urine rather than the poos, would you say?
Poo seems sort of normal.
Is he peeing normally?
Yes.
Yeah, that side of things is fine. Good. Hi, young man.
Hello.
Hello.
Can you say hello to the doctor?
Has there been anything coming out of his ears at all?
No.
Good. Temperature 37.7, so it's kind of just slightly above the kind of threshold. If you hold him looking towards you, I'm just going to have a quick check in and around his neck. Talk to Mummy.
Hey.
Say hi.
You're not going to say hello to me? Louis.
Okay, so no glands that I can feel. And actually, while you're holding him like that, I'll have a listen to the back of his lungs. That's it, that's lovely. Perfect. Okay, if we swivel him round just a little bit, actually, if you wanted, you can lie him down across your laps. I'm just going to press on his tummy. That's perfect, just as you are. Hi, young man.
Hi.
Lips are moist, which is very good. Hi. He's got a lovely colour about him. He's not struggling to breathe, which is brilliant.
You enjoying that little massage there?
Yes. Don't normally get this on the NHS.
No.
That's a lovely smile there, young man. We're going to shine a light just in his throat, just to see how that looks. Here we go.
Good boy, aren't you?
Very quickly. It does make them gag a little bit. All done. Perfect.
Okay, good
So,
boy.
no sign of any obvious infections there. He's well hydrated, lovely colour, breathing beautifully. No sign of any infection anywhere. You look very well, young man. So no concerns from my point of view.
All right. Are you happy?
He certainly is. He looks it.
Thank you so much.
You're most welcome.
Right, say bye to the doctor now.
You're going to wave. We're going to wave. There's a bit of a kind of opening of his hands there. Fantastic. Take care.
Okay,
All the best. Bye.
Bye now.
Hello.
My partner comes in with me.
That's all right, as long as you're happy.
Yes.
Yeah. Yeah, have a sit.
Thank you.
My name is Dr. Bajola. And how can I help you, Gary?
I suffer with alcoholism and I've been drinking and drinking for 30 odd years and it's made me ill. I've been in hospital, but the last year or so it's cost me my marriage and I'm getting iller and iller and I really now know I need help and I want to get better. I know you haven't got a miracle pill or injection, but please, I need help.
Okay, so it's a little bit inflamed in that area. So we'll have one more go.
You're the boss.
You need to come to my house and tell them that.
I'm all for keeping yourself alive.
Yeah.
Have to be honest with things, don't you?
I want to live longer.
Yeah, okay.
I'm ever so glad I come now.
Yes, you've done absolutely the right thing.
Thank you so much for putting up with me. I do appreciate everything you've done.
You just say thank you.
Oh, Dwayne, thank you so much.
No worries. Thank you very much for doing that.
No
I
problem.
appreciate what you've done so far as well.
Oh, no problem. That's really nice of you. Absolutely not necessary. It's part of my job.
So I understand your main issue is alcohol problem, and obviously it's affecting your life now.
Yes.
And you want to be
Stop.
cleaner.
Yes.
So how much are you drinking at the moment?
As much as I can. I start drinking first thing in the morning. As soon as I open my eyes, I drink till I pass out. Wake up, drink again till I pass out. Sometimes I don't eat for
What do you
3 or 4
drink?
days. Anything. But this morning, last night, I promised my
Tailor.
grandson I'd never
How many
drink
cans does he normally have?
Between 8 and 16 a day.
8 and 16 a day.
Yeah.
Anything else does he drink?
No. Not
No?
really.
This morning I got up and drank her vodka. I found vodka. And
Yeah.
that's what
Have you seen any alcohol treatment before?
Yes, years ago, but I keep thinking I
Many
can get
years
myself
ago.
better.
Many years ago.
All right. Okay. Yeah. Yeah. Are you eating all right?
No, I don't hardly eat at all, honey.
All
If I
right.
could go 4 or 5 days with no food, I don't care if you put me to sleep.
Can I have a look at your hands?
Oh, that's my
Yeah, we showed the doctor your hand. That's what you told me the other day.
Oh, just see, I punch things. I get so angry.
You're going to make a fist?
It's all right. It's a little bit sore, honestly. But it's not about that. It's
Can I have a
about-
look?
It's in it.
Okay. That's all right. Okay.
But this is the first time I really know I need help. I can't do it on my own.
I need to give you the phone numbers and address where you can see this alcohol nurse. You see them, they assess you, they'll ask for the blood test, and they give you community detox. Yeah?
Yeah, I'll try anything. Yeah.
Because what we have done studies in the past where I can give you tablets, but without support it never works. Yeah? I don't want you to stop drinking all of a sudden, because then you will start having withdrawals and you could end up having fits, which is not right. Okay? Regarding this punching, I think it's better to have an X-ray.
That's okay. It's just a little thing.
If you want to have an X-ray, I can book
No,
it.
it's fine, honestly. It's not. That's
If you
not
change your
what I
mind, let us
do.
know. Yeah? Okay?
Thank you very much. And you can't just stop drinking, can you? You're going to get help.
So, Gary, this works as a self-referral. So, if you're committed, you need to ring them and make an appointment. Yeah?
Yeah. It's a long time.
Okay. That's a blood form, which is very important. So, once the bloods are done, make an appointment after 4 or 5 days to see the doctor to discuss the blood results. And once they assess you and bloods are done, and if you agree with it, then they will give you community detox so that you can stop drinking. And then after that, they give you support so that you don't start drinking again. You can also go to Alcohol Anonymous as well once you're clean, so that helps you. Or you can start now if you're really keen on it. Okay. All right.
Thank you.
Thank you very much, Doctor.
Okay.
Thank you for your time.
All right. But don't stop drinking all of a sudden. Yeah? Okay?
Thank you.
Okay.
Thank you.
Yeah. Bye.
When I was a kid, I got some glass in my foot and it'd gone septic. So they took me to Children's Hospital in Sheffield, and literally all they did was local, cut it out, but there was a big mirror there. They went, you can look if you want, and I'm going, no, thank you.
I would have. I'm into all that gory stuff.
What we're going to do is an ellipse excision of epidermal cyst, because that's what I think it is.
Yeah.
On scalp. Okay, so reasonably low risk procedure, but there are potential risks because it involves cutting skin. So I just need to let you know about that. So infection is one of them.
Yeah.
Bleeding.
Yeah.
If we get the cyst out whole, then the chances of it coming back are much less. Not impossible. There's still a little cavity out there.
Yeah.
If we break the cyst, then it's much harder to get the whole sac out. And so actually that increases the chance, and we don't know until we do it, because it depends on whether I nick it with the scalpel.
Yeah.
So if you can sign away, unless you want to ask me anything.
No, that's fine. You explained it properly to me. Did you go anywhere or just took time off?
No, so it was a fasting month. So I was just taking time off to basically survive the last 2 weeks, really.
Oh, okay.
So
do you feel grumpy and no food or?
No, actually, it's more fatigue. It's more fatigue. Eating and drinking is not a problem. You get kind of sort of accustomed to it, yeah, absolutely. But yeah, I'm back to the land of living, which is good news for you for today.
What happened to your bits and boobs straw?
Alison got rid of it when she came back because she didn't like it. And now there's bits and boobs everywhere.
This is my girlfriend. Nice to meet you both. How can I help?
Benzoyl peroxide.
Okay.
I was wondering if I can get some sort of benzoyl peroxide.
Yeah.
On my face.
Yeah, to get some more, yeah. Okay.
Duo or something. We was talking about Roaccutane.
Yeah.
I think that was Roaccutane, but he was on about saying I need to get referred to the hospital or something for that.
Roaccutane is actually a brand name for the drug isotretinoin, and we use this medication in cases of moderate to severe acne, but more importantly in patients who we think are at risk perhaps of developing scarring as a result of their acne. So your acne, is it mainly just in your face, or does it affect your back and chest?
I don't know.
Mostly the shoulders.
Yeah, my shoulders.
Shoulders and then face.
Yeah.
Okay. So, how long have you been having treatment for your acne for?
I mean, I've had it for about 5 years now.
5 years,
I only
okay.
started getting treatment about 2 years ago.
Okay. So, what we do next really depends on you. We can keep going with the cream and the tablets if you think that it's making visible differences for you.
I mean, at the moment, I'm using tea tree oil.
Okay.
Just like putting a bit of that on my face just before I go to bed. It burns and stuff like that. But like, I get up in the morning, I have felt a significant difference between
that's
smoothness
fine.
and stuff like that.
I would say, looking at your skin, I'd classify this as moderate to perhaps quite severe acne in the way that it's presented on the face. So my recommendation anyway would be that if you've tried for 2 years and it's still at this point, I think certainly a referral to a skin specialist and consideration of that specialist medication or Accutane is certainly worth considering.
Yeah.
Unless you have some objections to that, unless you know.
That's fine,
Yeah. Okay. When the dermatologist sees you, he will go through some of the risks and benefits of this medication, the Accutane, because it's not entirely straightforward. There are some side effects that he'll probably go through with you.
My uncle's partner had acne and she had Accutane and stuff like that.
So you kind of...
She was saying that it burns and stuff like that.
Yeah.
But it made a hell of a difference.
Isotretinoin does require a lot of monitoring. It has been shown in some cases that the medication can have an effect on your mood and behaviour, and there have been some reports of people perhaps having thoughts of self-harm or even suicide with this medication. And so therefore it's usually initiated by a skin specialist or dermatologist. Okay, so what I'll do a referral and we'll give you some Epiduo and more of the tablets today. There you go. Okay. You'll hear from dermatology in the post with the appointment details.
Lovely.
All right.
Cheers.
Take care.
Darling, you sit right back and right up, and you've got to make yourself really comfortable.
Okay, so the first bit, nothing fancy, I'm just going to draw on your head. Okay, so just going to do a sharp scratch now, okay? I'm going to put a little drape over you as well.
Okay.
Just thinking, can we move that? Probably there, that's good. I'm just going to check, can you feel any of this? No? I'm not feeling nothing now. It's really tense, isn't it, the scalp? We put a vessel early. Got a very nice vascular scalp.
Oh, have I?
Yes. So it's oozing away nicely.
Good, good.
So we've got the cyst out.
Okay.
And it's come out whole, which is good.
Perfect.
I'm sorry if I grab a few hairs doing this.
No, no. Leave me some, please. Sir.
I thought I might just try and even the scalp out for you, that's all. I'm just going to take this off and I'll just give it a bit of a clean. Okay. This is the hairdressing bit now. So again, you won't thank me when you have to take this off, but it's good for now. So 2 days, yeah, of keeping this dressing that we're putting on.
Okay.
It did bleed a little bit, so if it starts oozing through today,
Yeah.
if it's going to happen, it's going to happen during the daytime today.
Okay.
Then I want you to just walk in at the front desk and point at your head to the receptionist, and they'll find something for you. It doesn't happen that often, but if it does start oozing through the dressing, then I want you to come back.
Okay, perfect.
Okay, Mum,
All right.
just sit forward for I've got some red streaks.
Highlights.
And the dressing, that remains on?
So sorry, yeah. So after 2 days, you could take all the dressings off,
Okay.
and you can leave it open and exposed to air.
Okay.
So that's the 2 days of completely dry and dressing on.
Yeah.
2 days time, take the dressing off, and then you can have a shower. Cool.
Yeah, no problem.
Good stuff. And the stitches out 10 days. Just let them know downstairs.
Yeah, okay.
And that's it. That's your lot.
Thanks for your time.
All right, thank you
very much.
Cheers. Bye-bye.
Bye.
See ya.
The emergency doctor said she's picked me in.
With the emergency doctor?
Yeah.
What's your name?
Alison Sloaney.
Take a seat next door, please.
Hi, I'm Dr. Taylor.
Oh.
I've got with you.
My son.
Okay, how can I help?
My back's pain, absolute shit. It's really bad. I can't rest. I haven't slept for 2 nights now. I've taken sleeping drugs, but I still can't sleep.
How long have you been suffering with back pain for?
About 20 years.
So this is an ongoing thing?
Yeah.
Okay. And I can see you've seen the specialist as well?
Yeah, he said he can't do nothing for me.
Okay. Have you had physiotherapy and things for it as well?
Yeah, they said they can't do nothing.
Okay.
So I'm in limbo, you know.
How can I help you today?
Yesterday I had pains in my stomach and my lower back all day.
Just the last while I've been feeling a bit sick.
Those tablets are making me feel sick and horrible.
She has a bad cough, doctor. Day before night, she vomited.
And otherwise, has she been off her food at all?
Nothing
like that.
He was sick Monday night. He did start to have that sort of migraine-y, strainy look.
Just feel constantly sick all the time.
We go through quite a lot of these little sick bucket things. Personally. Was someone sick today?
Yes.
Hello, Samantha. Come on in and have a seat. I'm Dr. Bolger. We've met before, I think, haven't we? How can I help today?
Basically, I'm just struggling really with keeping the pain and the sickness under control. I've been vomiting since Wednesday, but I can't keep anything down now. My anti-sickness isn't doing anything now. I'm bringing that up.
What are you taking for anti-sickness?
Cyclizine 3 times a day. This morning I took my first painkillers about 5:15.
And which painkillers are we talking about?
Cocodamol, tramadol. I took morphine a couple of hours later, brought that up as well.
So you're taking tramadol, morphine, cocodamol?
Yeah. It's for
Right.
the chronic pain condition, and that's escalating now because I can't keep the...
And what's the plan with the chronic pain condition?
I'm waiting to see Hammersmith Hospital again. They're looking at my pancreas and the secretion because they can't seem to find out what is going on yet.
Right, okay, so let's check you over.
Thank you.
Feverish with it?
Cold,
Yeah, hot and
I've had
cold.
diarrhea and it's sort of hard to know if I've got bug because I have these symptoms so often.
It does come very often now, doesn't
Yeah,
it?
but
Are you ever pain-free?
No, it's always there.
And they can't come up with any diagnosis for
No,
you?
they took my gallbladder out last year thinking that would
I
help,
remember,
it made it
yeah.
a bit worse.
Okay, right, let's get you across. Let's check you over, yeah? So really, if we could stop you vomiting, you could
Yeah.
keep your painkillers down,
Yeah.
or you could keep your fluids, couldn't you?
That's it, it's a bit
So
of a cycle.
cyclizine,
Yeah.
which is a good anti-sickness pill. Have you been on any others?
They tried me on Dansetron, but that they worried we didn't track with my citalopram, and they tried me also on metoclopramide.
Show me where the pain is. Lift
Okay.
up for me. You're okay for me to examine you,
Yeah,
aren't you?
that's fine. So at
Right.
the moment it's here and it's going round to there.
And that's where it always is.
Yeah,
isn't
it keeps going shooting up to my shoulder. That's the worst bit.
Okay, that's fine. Come back
Thank you.
across. I'm trying to think of something we can try for the sickness that hasn't been tried. Let me just go through your notes. Because the other option is you going up to A&E.
Yeah, I just try and avoid. Only
I know, I
because
can understand that.
I'm in for a few days normally. I'm normally in every month, but I've avoided it for the last few weeks. But I feel like I'm sort of
on the edge.
Yeah, and I feel like I'm just being stubborn now. So I think I probably do have to go back in, but. I think I'm just in a panic mode at the moment. What's left to try about going back? But I think I might have to.
You've had the domperidone, they've tried it before. We could
Yeah.
try it short term. They're right, it's not a long term solution, but just to see if we could try and get you to keep some fluids down.
Yeah.
The other alternative is A&E. Should we
Okay.
try some domperidone at least during the course of today?
I'm happy to take some time.
I think if this doesn't work, then you need to either call us again or go up to A&E as you normally do.
Thank you.
It's no problem.
Where in the back is the pain?
It's just
Across the lower back. Yeah. Does it move anywhere or does it stay in the back?
it goes in my legs
It goes in your legs.
and my fingers.
Okay. And have you got normal control over your bowels and your bladder? You're not having any accidents?
No, but it's like my bum's numb.
Okay.
And has anything happened recently? Any injury or any trauma? Fine. What I'd like to do today is examine you.
Can you wait outside a minute, please?
Mm.
Thank you, Jonathan.
Okay.
Yeah. Sorry about this.
Not at all. You have to be sorry. I'm sorry that you're in so much pain.
I don't normally come as well.
What I'm going to ask you to do is just to lie on the couch for me. Can you just I'm going to tap on the legs, and I want you to say yes when you feel me tap, okay?
Sorry. Oh, God.
You okay for me to continue?
Yeah. It's really bad.
Do you want to sit up for a second?
Yeah.
Yeah? I'll give you a hand. Just take a second.
Oh, I feel dizzy.
I'll get a lady to come in. Got my colleague Hannah with me, okay? So I'm going to be examining the back bottom, okay? So what I'm going to ask Hannah to do is just to kind of be with us when I examine you, all right? So I'm going to wind the curtain round. And if you just lower your bottom things, yeah, okay. Okay, so all I need you to do is say, number one, whether you feel it, and then number two, I'm going to ask you to squeeze down on my finger. Okay? Okay, can you feel that there?
Yes.
Now, what I'd like you to do is now try and just squeeze down on my finger.
That's it, I can't do it.
And just try one more time. That's fine, okay. Thanks. Alrighty. So, the reason I examined you is wanted to just make sure that there's no other sort of concerning signs that your nerves are being involved in your back pain, okay, which I don't think they are. It's not really a painkiller that you need, but actually something to release some of the tension in the muscles, because I think it's the spasm that's causing most of this pain at the moment. So there's something called diazepam, which you've probably had before. Yeah, and I would like to maybe try a short course of that, maybe 5 days worth, to take it 3 times a day, and that might just help ease the spasm. Now, obviously, in that time, if the pain gets worse, if you start losing control of your bladder, your bowel, or the numbness gets worse, then you come back and let us know. Okay? Let's try that and see how you get on.
All right,
okay.
then.
All right.
Cheers.
You're welcome.
Thank you.
Okay, take care. Bye-bye.
Jonathan.
One morning last week, we were walking across the ring by the scout hut, and some bloke's gone past with a dog, or bug, down that sort of alleyway. Short sleeve t-shirt and shorts. I thought, bloody thing. I had a jacket on, a scarf on, gloves on, and he's got a short sleeve t-shirt and shorts.
So a bloke walks past the house in the morning with the dog, and he's got his shorts on. I figure, it's about time in the morning, not awake then.
Okay, so let's have a look. So you had some bleeding, did you?
Yeah.
That's settled now?
I haven't done anything since, gosh.
Okay. So you're quite keen to start HRT? Okay.
I don't know what it is.
Okay,
It's
hormone replacement therapy, so it's basically replacing the hormones that you previously had.
Yeah.
And when did you go through the menopause?
Oh, God, well, I didn't know I was. I'd say from when I had Riley.
Okay, 42. Okay. So you're using any form of contraception at the moment? Okay.
I ain't done anything.
Okay.
Got no sex drive, nothing.
Okay. And how are you feeling otherwise?
I'm a bit of a mad, a bit moody and, you know.
So the estrogen will help with that. Okay. So there's two main female hormones, and one's called estrogen, one's called progesterone, and they do different things, okay? But we'd have to replace both of them. It has lots of positive effects, okay? So, you know, and it has, you know, helps protect against osteoporosis and things like that. But unfortunately, estrogen has also a few not so great things, and that's why I don't know if you know about all the bad press that went along with the HRT and things, that the risks of sort of developing blood clots.
But obviously you keep an eye on things like that.
Completely. So we would expect you to come in every 6 months, have a blood pressure check, talk through how you're feeling. But it's for you to be aware of, because actually they're quite, although the risks are very, very low.
Quite serious things.
Completely. Okay, so there's lots of good things and lots of bad things.
Scaring the life out of me now. Go on.
No, I just need to tell you, it is about trialling it, okay, and obviously doing all that you can to keep your risks down. I'm naming big names, but the risks are very small, but obviously the cancers of the womb and the ovary as well, but that's where the progesterone comes in, okay, because estrogen will build up the lining of your womb again, okay, which is a risk factor for developing cancer of the womb. So, so what the progesterone do will just shed it away, so you'll have a bleed every month like you used to.
Oh, really?
Yeah, completely.
Great. I don't get any now.
Okay, so it's just one tablet every day. I want you to come back and see us before you run out. If you develop any pain in the leg, in the chest, stop taking them straight away, see a doctor. Okay, have a read of the leaflet.
Will it be severe pain? I know it's not right pain, won't I?
It won't be something little, okay. But if you've got any concerns, please do come and discuss it with one of us.
If I just think something's not right, so I just not take the next one and then make an appointment.
Well, you can actually just speak to a doctor over the phone and say, look, I've just started taking it. Can I just check?
Cool.
All right, so don't worry.
Yeah, thank you very much.
Bye-bye.
Cheers, bye.
Oh, I'm having stir fry for dinner.
What are you having for dinner?
Stir fry. I haven't had stir fry in ages.
Are you making it?
I'm technically making it because I'll be putting my noodles with my stir fry and then like putting it all together.
That's a stir fry.
I'm putting it on my plate. Yeah. Kind of making it, I guess.
You're stirring it in a pan?
I'm stirring it and frying it.
Hello.
Hello.
Right, which one's John?
Me.
All right, have a seat, John. I'm Julie, how can I help?
Every time I breathe in, I get a pain in my chest.
All right, OK. How long's that been going on for?
Since yesterday. You can hear it.
Oh, I can hear the wheeze, yeah. And it's normally asthma, Mum, or?
Yeah, he's got a little bit of a tight chest.
Yeah, so has he used inhalers before?
No.
No. OK. All right, we're just going to...
When he was younger, yeah.
When he was younger?
Yeah, he was quite asthmatic, like...
Oh, he did have asthma when he was younger?
Younger, yeah.
Right, just stand up for me. That's it. Just breathe in and out through your mouth. You're quite wheezy there, aren't you? Just have a seat, John. Let's pop your finger.
Jimmy.
That's a good one. Okay. So what I'd like to do is give him the nebulizer, okay, and then I'll check him again.
Is it very serious?
No, darling, it's just your asthma that's just come back, that's all. I'll give you the medicine through the mask.
Morning, Timothy. Hi.
Morning.
Come through, come and grab a seat. Thank you for waiting. Sorry about the delay, Timothy. How can I help today?
Right, I need a full range cholesterol test.
Yep.
And I've got a broken rib, at least one broken rib.
Okay, all right. In terms of medication, what medication are you taking at the moment, Timothy?
At the moment, just tamilocin, but I'm going to start taking my heart medication again.
Have you ever had a heart attack before?
Yes, I've had two.
Okay. And in terms of the heart medication, why did you stop the heart medication?
I was having too many side effects and...
Okay. The medication that you're given is very good medication. Has actually been shown to be protective after people have had heart attacks.
Yeah.
Okay. So patients who've had heart attacks, they should be on these medications.
Well, yeah.
Yeah. And Timothy, the other question I have for you is, in terms of alcohol, how much alcohol are you drinking at the moment?
Probably about 2 pints a day.
Okay. And have you tried to cut down?
I don't need to. I have a thiamine deficiency and I drink Guinness, which prescribed by a consultant 20 years ago.
Thiamine is a B vitamin, and its deficiency can result in multiple signs and symptoms, and it can affect the cardiovascular, neurological, and gastrointestinal tracts. Some of the signs and symptoms include nausea, vomiting, and fatigue.
I became deficient in thiamine, and I ended up being seriously ill for 9 months, and I ended up in hospital. And a friend took me out for a drink. I had 2 pints of Guinness and I was cured.
Most people associate Guinness with high iron content. Guinness or any other alcohol is not a recommended treatment for thiamine or iron deficiency. We can treat both of these with effective nutrition, and also if it's severe, we can give medication.
There's well-documented evidence about what safe levels of drinking are.
That's right.
And safe level of drinking for men, now the current guidance is 14 units per week.
Yeah, well, I drink 1 can of Guinness in the morning and 1 at night.
Okay, so 14 units per week, and you should have at least 2 alcohol-free days in a week. That's the safe
No,
limit.
if I had 2 alcohol-free days, I wouldn't be able to work.
Listen to your tummy. Do you want to put it on for me? I can hear your lunch. What did you have for lunch?
Peanut butter sandwich.
Peanut butter sandwich. I had peanut butter sandwich as well.
You've got 2 girlfriends? Oh, that's a lot.
We'll have some more.
Oh, what's your son up to?
How is the vacation going?
Well done.
Where are you off to, mister?
Thank you.
You're very welcome. All right. I hope you feel better.
So all it is, it's just the medicine, but it's just going through the mask, and it'll be like steam that comes out. Okay, so like steam in your face. You just have to breathe normally. That's it, good boy. Oh, it helps if I plug you in. Right, can you jump up off there for me, and I'll just start writing up his notes. That's it, good lad.
Hopefully you don't get worse.
So can you remember when he last used inhalers, Mum?
It's usually during the summer.
Just sometimes in the summer with hay fever, he might have some problems. And then does he use the blue inhaler? Don't press on anything. Or it might all disappear.
Feel better, Jimmy? In your chest.
Are they feeling any easier?
Yeah, it's feeling a lot easier, but I can still feel that a little bit.
Just...
God help. Thomas is looking straight at you.
You're very curious, aren't you?
Kevin.
Wow.
I'm going to go back in. It's just I'm asking these 2 to stop playing up a bit.
Wait till that stops steaming. Just keep shaking it slightly just to get rid of those last few drops. Don't feel any better when you're breathing in?
Yeah.
Yeah?
I can breathe deeper now.
Good, good. So what I'll do, Mum, I'll give him some inhalers, and I just want to check his chest again. It's in your purse.
Kevin, we're talking to the nurse. Yeah, in a minute, Kevin.
Unless I have Guinness, I can't work.
Do you ever feel shaky in the morning?
No.
Do you ever crave the alcohol?
No. I don't even like the taste of Guinness.
My job is to make sure that you live until you're 150, all right? That's my job.
And you just have to take it from me that if a consultant recommends that I have 2 pints of Guinness a day,
Yeah.
and I know that to be a fact.
Timothy, I can assure you, as your GP today, that it is not good for your health, okay?
It's important in our role as general practitioners that when we encounter patients who don't want to change their ways, that we don't get frustrated. And our job is to offer the correct evidence-based advice to hopefully allow the patient to one day change their ways and adhere to the correct treatment plan.
I know my body, so there's no point you trying to tell me that it's not. Your opinion on Guinness is totally different from my experience. I don't drink excess alcohol.
Okay. Now, Timothy, in terms of the broken ribs, tell me what happened.
I fell off a motorbike in Kenya
When was that?
about a month ago.
Soreness on the right side of the chest.
Yeah.
What I want you to do is stand up for me. The pain, is that tender there?
Yeah, just a little bit.
Okay.
Yeah.
Turn around.
Broken rib is in
Turn
that
around.
area.
Okay. Take some big breaths in and out. And out. And again. And out. In terms of the chest,
I need an X-ray.
for a broken rib or for a query broken rib, we do not X-ray unless there's certain indications. That makes sense. Your chest is clear. There's no evidence that you have an infection in the chest, which is good. You've got good air entry on both sides. Your oxygen levels are perfect, so you do not need an X-ray.
Right, so you're confident that the rib is healing up?
Even if it was broken,
Yeah.
we don't X-ray because the treatment, whether it's broken or not broken, doesn't change. It's pain relief, and it will heal.
No, that's not strictly true, because if the rib is not healing correctly...
Yeah, because at the moment, there's no indication for us to get the X-ray.
Right.
Keep going with the pain relief, and this should settle down, okay?
Yeah.
If it's not settled down in the next 3 to 4 weeks' time, you come back in and see us.
3 to 6 weeks, a rib's supposed to heal.
So, Timothy, in terms of moving forward now, okay, take the pain relief and let's see how we go. Okay. All right then, Betty.
Thanks a lot.
No trouble.
So I think we'll treat him full on as asthmatic with the steroid inhaler and just to get on top of things.
Jimmy's not feeling well, Kevin, so you've got to just have patience.
Right, lovely. I think that's done now, isn't it? That's it. Good lad. Okay, so I just need to have a look at your brother again now. Okay, so you stand over there with Mum.
Good boy, Luke. Stand
That's
here.
it. Let's have you on the scales then. That's it. Okay, 48.
Stone.
No, that's kilograms. Okay, you jump up because I need to be here. That's it, thank you.
Kilograms.
Right, let me just check your chest again and then we'll get your medication.
It's a lot less squeaky than it was before.
Yeah. There's still a little bit of a squeak there, but it's a lot better. Sounds a lot better.
Luke, Kevin, why are you doing this, Kevin?
So he'll definitely need some steroids. Okay, jump up.
Those steroids make you get muscly.
They might do, eh? So I'll give you a brown inhaler. Okay, so take 2 puffs in the morning, 2 puffs in the evening.
Okay.
And a blue inhaler. Okay, so the blue inhaler you take, whilst your chest is bad, take it every 4 hours.
So the brown one, 2 in the morning
And 2 in the evening, right.
Are we going in now?
What do you say, boys?
Twice in the morning, twice in the evening.
What do you say, boys?
Well done.
And
You take it to nurse, Kate? Thank you ever so much, nurse. I appreciate that.
All right then, take care. Okay.
Bye-bye. Say bye-bye, boys.
Get those stickers. There you go.
Thank you.
All right
Thanks
then,
ever so
bye-bye.
much. Bye-bye.
We'll see you next time.
Yeah.
All right. Bye-bye.
Excellent.
Thank you very much.
No trouble. Lovely to see you. Bye-bye.
Sorry to be a pain.
You're not a pain at all. I'll see you in a couple of weeks, yeah?
Thank you very much.
Bye-bye.
Bye-bye.
Good afternoon, Farnham Road Surgery. How can I help? So, what's your date of birth, please?
How can I help?
If I'm honest, the symptoms that I feel now are kind of like the symptoms that I felt when I had cancer.
Is it possible for him to reduce the volume? Sorry, just 5 minutes.
Sorry,
you can do it on the... Oh.
Is it both sides or just this side?
And you can keep my picture.
Yeah.
And this may be worth a fortune, you never know.
You never know.
Oh, the cream's worked then, has it? Oh, good.
What you call lovely jubbly.
Excellent.
Is it OK if I examine your tummy?
What now?
Yeah.
No,
Can we do a back passage examination as well?
Oh, my goodness. don't know what you're doing there. Look at the face. Wow.
Lexi, come through. Come in, come and take a seat. Hi.
Right.
Right, how can I help?
I thought she might have thrush. But the doctor said she might have a urine infection as well.
Okay. So did you bring a urine sample in? Lovely.
It's happened in the past before. She's fine during the day, but then at night she starts really screaming and crying. It's hurting down below.
Yeah. Really?
Yeah.
Okay.
So we didn't know what it was.
Okay, and in the last 2 nights she was saying this,
it's
and when
both.
you look down below, Mum, is there anything that you've noticed?
It's nothing. The inside is a bit red.
Any blisters, spots, anything at all? No. Okay. So you brought the sample.
I
What
did.
we'll do is we'll dip the sample.
What it's in.
Oh, it's okay.
I put it in that's all I had to put it in.
Just don't drink it.
No.
Mummy.
Yes.
It's like, wait.
It is. It's yours.
Is it her first morning one?
First weed.
Yeah, this is the wee.
Yeah,
This morning.
It's my week.
Is it? No, there's no infection, so there's no blood. What I'll do is, can we have an examination? Is that possible?
Right, you're going to lay on the bed?
We'll just slowly have a look and just look. Is that okay? Do you want to come behind the curtain with her, Mum? Do you want to pop her on here for me?
Whoosh!
Can I take a seat? What can I do for Logan?
Right, well, we saw the doctor this morning about his, closed, droopy eye, and we were told if there was anything else to come back. He said he's getting a bit of blurred vision and double vision in that eye.
Look at me, Logan. No, not your game. Just look at me.
Let me hold that for a minute.
No, don't you.
I won't play it.
Where do you think it's droopy? A little bit full, isn't it? More than droopy, I would
Yeah,
say. It looks like the lid's almost a bit swollen.
Yeah.
It is not.
Is it not?
Doctor felt and she couldn't obviously feel anything.
you.
Hang on.
Logan, will you do a few things to me?
No.
It's
Because you'll
on.
unpause it.
It won't. It'll be fine.
You do a few things for me, Logan. Copy what I do. Screw your eyes up as tight as you can. Really, really tight. Okay, and open. Lift, that's it. Eye rise right up like that. Fantastic. And down. Blow your cheeks out. Go on. Okay. Now, follow my finger with your eye. Is that all okay? No, this is the tricky one. Is that okay? Any problems with that?
I can even cross
You
my
can
eyes,
do it
no
yourself,
problem
but
with
did
me.
you only ever see one of my finger?
Yeah.
Yeah, okay.
Can I just feel your tummy? Any pain at all? No. So if a urine infection, you'd get pain around here.
Okay.
No, that's fine.
That's good to know.
No, that all looks normal, actually. But because it's been going on for a while, I think we should try the anti-thrush treatment, because you said you've tried pseudocreme and it's not helping.
Yeah, it doesn't seem to do much,
Yeah.
to be honest.
Stand up for me.
That's it. I'll let you get ready.
Right.
So let's give her a tiny bit of the canister cream that we normally use.
Right. We'll sit back up. Oh, there we go. Ah, can you share with me? Oh, thank you.
So just apply it twice a day.
Okay.
And just for 5 to 7 days maximum, like a week. There we go.
We'll get you some proper cream.
Oh, you're so sweet. Well, nice to meet you, Lexi. Oh.
Say thank you.
Thank you.
It's okay.
Right, come on.
Come on.
All right then. Take
Right,
care.
thanks for that, darling.
It's okay.
Right, you're going to say bye.
Bye.
Right, let's go. Thank you very
Bye.
much.
It's okay. Bye.
So you can get a swollen upper eyelid that makes it look like it's drooping because this is bigger in size. And I think that's what we've got going on here,
Right.
rather than the eyelid itself isn't moving properly.
Right,
Because his
okay.
eyelid is moving beautifully. So we give him some eye drops and it will all settle down.
It's not a problem, is it? We don't
What
mind.
eye drops?
Eye drops are like liquid in a bottle and we drop them into your eye.
Okay.
You can do it or Mum can do it. But it's quite difficult to put your own eye drops in, even when you're a grown-up, so I would maybe let Mum do it.
It's tricky. I've had eye
Why
drops
don't you just
before.
put it in the shower and then just go
All right.
Yeah.
Take care.
Thank you very much.
Nice to
What
see
if
you.
it doesn't settle down?
Well, then, no,
Then
I will
you
have
keep
the
taking
I
them.
will have the pleasure of seeing you again.
Oh, the lovely pleasure. Hey, come on then.
All right.
Thank you
Do
very
bring
much.
him back if you're worried. Give it till Friday. If it's not better, bring him back.
Yeah.
Okay. Bye-bye.
Nurse for flu jab, and it's 7 days. Come back and see a nurse after taking these.
By a nurse, what do they need to take your blood pressure or anything?
No, she said to see if the infection has gone in the ear, and flu injection as well. You know, do it all in one. Yeah.
We'll try.
Thank you. Does she look like Amy next door a bit? Amy? No. No? You don't think so?
I hope she's not ugly.
Yeah.
Hi, come on in. How can I help?
It's obviously a range of things.
Yeah.
I've had like a really bad cough for over a month now.
Okay.
My chest isn't wheezy. It doesn't hurt when I breathe. I'm not in pain with it. But I get out of breath really quickly, like now. I'm out of breath just from telling you that.
Yeah.
There's a lump or something in my ear. If I'm honest, this is going to sound really stupid, but the symptoms that I feel now are kind of like the symptoms that I felt when I had cancer. I had trophoblastic disease, and it's just like all the little things, like my mouth started, like the taste of food that I liked.
Yeah.
I'd gone off it, and it's like they're all the symptoms that I had when I had to have chemotherapy, and they found out I had cancerous cells in my lungs.
Okay.
It just seems to be all the same. I feel really drained. Like I don't feel like a healthy 19-year-old. I feel more like a 60-year-old, if I'm honest.
Yeah.
I just don't know what's wrong with me. I've actually really not been well for quite a while, but the main thing is obviously my chest,
The chest,
my
okay.
ear, and just generally feeling
not
the
quite
way
right.
I do. Yeah.
Okay.
Holly had a rare form of cancer called trophoblastic disease shortly after she fell pregnant. What happened in her pregnancy is that the cells of the placenta and the growing fetus started to multiply abnormally like a cancer. In Holly's case, the cancer had spread to the lungs, and she underwent chemotherapy, which successfully treated the cancer.
If we start with the chest, so you've not had a history of asthma in the past. You've never had to use any inhalers or anything like that.
I got given a blue pump, but it doesn't work. It
Okay.
doesn't do anything to me.
Okay. And you mentioned your ear. Did you actually feel a lump? Because I mentioned when you spoke to the doctor, there's a lump there.
It's like I can feel a lump in my ear, but I'm not sure whether it's my ear or whether it's swollen, but it's just really sore to touch, and it just feels like it's inflamed.
And do you smoke at the moment?
I do smoke,
Okay, how much a day?
if I'm honest, like 10 to 15 a day.
Okay. Do you want to just take some breaths in and out of your mouth for me?
It's making me go lightheaded.
You all right?
Yeah, I just feel lightheaded from like where I keep breathing in and out
Okay,
a lot.
just breathe normally. Don't worry about taking deep breaths in, okay? And just show me this area on the ear that you mentioned that was...
It's inside my ear.
Any discharge from the ear?
No, ow.
Is it tender if I'm pressing there?
No, but if you like stick it in the way you did, that hurt.
I know obviously you're worried, given everything that happened in the past, that this might be signs that things are going wrong again.
Any patient that's had a history of cancer, especially someone as young as Holly, it's very common to see anxieties later on in life regarding their health. However, in Holly's case, I was quite confident that the cancer that she had was very specifically related to pregnancy and therefore very unlikely to be related to the symptoms she was currently presenting with.
When I listened to your chest, it sounded very clear. There aren't any noises there. Like you said, it doesn't sound wheezy.
No. It's just literally of the fact that I get
Yeah.
short of breath really, really quickly.
And there's lots of causes for why someone might become short of breath, and that can even be things like anemia as well.
Okay.
So I think the first thing that we could do is a chest X-ray. Okay. I was thinking of doing some blood tests, and then maybe we can catch up in a week or so once you've had those tests done, and kind of take things, from there. But what we could do is also refer you to our respiratory nurse, because this is the breathlessness. I just wonder whether this potentially could be asthma. The ear, when I looked inside the canal, it looked normal. Sometimes the canals can get a little bit inflamed, and you can get sort of an infection in the external canal.
Okay.
Wasn't any obvious evidence of that today, to be honest.
Okay, yeah, no, that's great. Thank you.
Is that all right?
Yeah, I really do appreciate it. Yeah.
Okay.
Thank you.
All right, take care.
You too.
Hello.
I'll cut straight to the chase. I think I know what it is. I slept funny. I'm getting this cramping sensation down my palm. It's like a spasm. It's not a heart attack, it's on that side, but it's just down there. I've slept funny, and you see it stay on my face. I can't even put my neck out, it kills. And I just wonder, I've got cocodamol from what I've been prescribed by the doctors. I shouldn't even say it's strong. I haven't slept all night.
Okay.
Oh, if you're going to...
Is it both sides or just this side?
But it's like it goes straight across my body.
And you were fine when you went to bed?
No, 3 days I've had this, but last night I haven't slept. Basically, it's like a spasm.
Yeah, you got a trapped nerve, haven't you?
Oh, is that what you feel?
Yeah,
Straight
can
away?
you
Yeah,
do that?
I can do that. That's why I didn't want to bother you.
Can you get it up to your head? Or have you never been able to?
I suppose I can. I'll tell you what happens. When I'm laying in bed, say that's my bed, if I put my arm across like that or lay down, it's all right. But my elbow keeps on locking, and it gives a bad spasm, like a proper, and it's like a griping sensation.
All right, Jonathan, you stand up for me. Need you to do some movements for me. Can you take it backwards?
So that's
all right, forwards.
My arm's shaking nearly.
Yeah. What about up? Oh, you don't like that, right? Okay. What about behind your back like that?
No. Look at my arm shaking.
Yeah. Okay, just relax for me.
Why can this always happen to me?
Okay, the whole thing's gone into spasm, hasn't it? Can I have your elbow?
That's all right, but
that's not so bad, is it? It's the shoulder and the neck.
It's not hurt. Hurting's not the right word. It's more aggravating because I'm not sleeping.
So we'll give you some diazepam and some naproxen. Naproxen twice a day with food, diazepam 3 times a day, and that should release the spasm.
Is there anything you can recommend? Not on tablets, but when I'm getting sleep, I need sleep. I'm so stressed.
Well, the diazepam will help you sleep.
Doing a desk job, I'll be alright, won't I?
Yeah, it'll be fine.
Just looking up in the air.
Yeah.
I went away in my work on a work conference, and the bed was so hard I didn't get sleep.
Oh dear.
No. Oh, thank God for that.
All right, take care, Mr. Roberts. Bye-bye.
My throat's not sore, but see, right down there, on fire.
Oh dear.
So there's a little squirt up here and a little squirt up there, so that you don't get nasty colds. Little tickle. That's it. Good boy. That's it.
Just a bit of it.
Great. Mr. Anwar, please. Hello. Come in.
I have got really sore throat, and it's terribly painful. Like yesterday, I couldn't even speak.
Yeah. That's what I was wondering, because you were prescribed some antibiotics yesterday.
Yeah.
So you've only had less than 24 hours of it. Is it possible for him to reduce the volume on the phone?
Sorry.
Sorry, just 5 minutes. You can do it on a. Oh.
Sorry.
No problem. Don't worry. Okay.
Yesterday morning, when I spoke to the doctor, she said, any vomiting? I said, not yet. But I did vomit after, like, you can say, around 10ish.
Okay.
And that was a yellow fluid. Yellow, thick fluid.
Okay.
I don't know what was that.
Have you been coughing as well?
Oh, yeah.
Yeah. It could be a mixture of sputum. Have you got any pain anywhere?
It's still in there.
Apart from there, like in your stomach?
No.
If you open your mouth for me?
Ah.
Say, ah.
Ah.
Okay, so I can see there's a lot of white spots and exudate in the back of the throat there. So it looks quite angry, the tonsils. So, in many ways, you're on the right treatment already because you've just started the antibiotic course. So it's been less than 24 hours, so I wouldn't expect it to have suddenly got much better in terms of the infection side. But clearly you're still having symptoms and pain. So I'm just going to tickle the back of your throat. If you open your mouth for me, yeah? Say ah.
Ah. Ah. Ah.
That's it.
Good one, mate. If you...
No, I've done it. Okay, so I'll send this off. Take the antibiotic course. I'll write down medication that you can try. Whilst you're unwell, make sure you drink plenty of fluids.
That's what they told me yesterday as well.
Eat small amounts. You don't have to have a big meal straight away because your stomach needs to adjust. But if you take any painkillers, particularly this one for your throat, naproxen, take it after food, right? But I am going to give you a tablet to try and settle your stomach. Right? But if you find there's any vomiting of very big sort of brown stuff or any blood, you must seek attention again. You've got a likely infection, and most of the time these can be viruses, but I think with your situation with the pus on the back, which is why I've swabbed it, it could be a bacterial cause for this. Time is what you need to settle. All right?
Thanks, Rob.
And rest. Okay?
Thank you. Thank you
Bye-bye.
very much.
Take care.
Cheers.
Watched 50 Shades last night. Did you? I love that film. I prefer the book because in when I was reading the book, of course, I pictured him very differently. Yeah. You know, a little bit more tall, a little bit more buff, kind of, and her completely different. Which now I've gotten used to her kind of thing.
It's a smile when she goes.
Yeah, even the way she bites her lip was supposed to be a little bit more.
I know.
Never mind.
Michael Troy. Hello, how are you?
No, Doctor.
Nice to see you. Come right in. Just take a seat. Oh, bang. Right, how can I help?
I'm trying to get an appointment with you.
I know, it's, well, you know.
You're obviously very busy.
Well, it's not just me, but all doctors. I mean, there are too few doctors in the country and there's too many patients.
They're overworked.
Well, we don't mind being overworked. It's just if we had more doctors would help. So we are under pressure, but on the other hand, we enjoy what we do, but we just wish there was a bigger machine. So how can I help?
Well, I'm very worried about this pain I have. Because when it first happened a year ago, over time you expect it to heal up.
Yes.
This has just got worse and worse and worse. And it's really bad now.
It came on when you were drilling overhead, I remember. So let's look at your bloods. Yeah, so what this test showed was that your hemoglobin was low. Do you eat red meat?
Very little.
You just don't like it? It's not...
I just don't have a desire for it. I like fish.
Yeah. You never had a desire much for red meat?
I used to. Occasionally, if I can get the appetite to eat it, I'll go out and go and get a takeaway curry.
Yes.
But they give me enough to feed about 5 people.
Yeah. So just slip off your shirt and let's have a look at it again. Right. Just show me where the pain is now.
Right, it's under my shoulder.
Yeah. Yeah.
Now, if I stand up,
yeah.
So I'm doing washing up or something like that, preparing a sandwich, it comes around here.
Were you ever a smoker?
Yeah, I smoke tobacco.
How much do you smoke?
Not a great deal.
Any pain there at all?
Yeah.
Deep breath. And that? So no pain in the center in your spine?
No.
Right, just lie flat for me. Yeah. Michael. Michael had been referred for physiotherapy, and he had been on a range of painkillers and also had been on gabapentin, which is a medication that changes the way in which nerves work and which we use for relief of pain.
This is where it is here.
Put out your tongue for me. Okay. Just roll to me slightly.
What's worrying me most is it's getting worse.
Yeah, indeed. Up you come, just dress up. I was concerned by the level of his pain, the fact that it wasn't responding to anything. And when I saw Michael and his obvious weight loss, I knew that this was probably going to be serious.
I'm a bit worried about it in case it's something else.
What were you thinking about?
Cancer.
Yeah,
But there's no sign of cancer on the male side of my family. Anywhere.
Yeah, but you're a smoker.
Oh, yes.
How many ounces do you smoke?
Not a lot.
Do you roll your own? You do?
Yes. And 1 cigarette, I'll get about 10 smokes out of it. Because it goes out. I have been thinking about giving it up again.
Well, I'd encourage that.
The only thing is that people don't realise, and I didn't, if you give up smoking, you must also give up eating, because you'll blow up.
Well, you're a long way from that at the moment, Michael.
Yeah.
So I'm going to refer you for further investigations into the pain, and we need to do some blood tests as well on you.
Sure. I'm just wondering if it's possible to get an MRI scan or something.
Well, they'll decide that. GPs aren't permitted to arrange MRI scans. It has to be a consultant, it has to be a hospital here.
I have so many things I want to do as well.
Seriously? Asthma? Phone?
Unfortunately, like I said, there's still got like 5 hours of work to do.
Just
taking a note. How do you feel about that?
Terrible. I'm not even thinking about it.
Pretend I've got a microphone.
Can I have a bit
How
of
do you
cake?
feel about that?
Terrible.
I'll interview you.
Go on then.
I don't know what to say.
I'd be as worried as you are. So you need to do these tests, and I'll be following them up, and I'm going to refer you into the hospital. Do you need any more medication at the moment?
Yes, please.
Yeah. So just the gabapentin and the tramadol, are they the things? Yeah. Okay. So we'll see if these tests bring us any nearer the diagnostic truth, but I'm really unhappy about your continuing to smoke. Whatever is the underlying problem, it's going to make it worse. So I'd really like you to at least cut down with a view to stopping, because it won't help the present situation. Michael did not present with a history of chronic obstructive airways disease or COPD. He wasn't talking about breathlessness or cough. He was really talking about pain. And so I wasn't really thinking about all of the other conditions that smoking undoubtedly causes or is associated with. I was really thinking about what could have caused this pain, and was he a smoker? And were the two linked? So I'll stay in touch with you. We'll get the blood tests, the urine tests, refer you in, and we'll just keep an eye on your weight until we get an answer. Sometimes the answers aren't that easy to get. We've done all the other stuff we should do, and that hasn't yielded any benefit. We now need to take it further.
Sure.
Okay.
So just go to the hospital anytime.
Monday to Friday, so go tomorrow, or even tonight. There's 2 hours left. And between 8 in the morning, 8 in the evening. I'm sorry it's continuing, but there's something going on here that we need to get put our finger on, okay? Yeah, nice to see you, Michael. Yeah.
Pleased about that now. Thank you, Doctor.
Yeah, you take care.
All right.
All the best. Bye now.
Right, so that's Wednesday, 11:10.
Doesn't look red, and I can see your TM at the bottom there.
It's fine, so it's on my jaw and my...
Yeah, because my daughter's got that, analgesia. That's all she has.
Yeah, because I grind my teeth.
Yeah, and Becky does. She really grinds her teeth.
Yeah.
Watch your feet here.
My ears hurts. I'm gonna check it now, baby. Oh.
Come through. Have a seat. Right, how can I help? Morning.
He does have an ear discharge from his left ear.
Right.
So last time when I visited the doctor, they given me 5 days of amoxiclav, and it subsided with that.
So when did he become unwell? When did this start?
Today morning, you know.
Right.
Today morning he wake up at 2 o'clock and he cried because he has an earache, and I given paracetamol 5 ml, and he slept.
So I did have a quick look before you came in. I know because of the history, he's had to had chemotherapy, I believe.
Yes.
Where is he in terms of treatment at the moment?
Treatment, he finished his chemo last July.
Okay.
So they are they are doing MRI scans every 3 months now.
Yeah.
And it's all clear till now.
That's good. George has had a very eventful life so far. When he was around the age of 3, he was found to have some developmental delay. He was subsequently found to have a tumour that's called a medulloblastoma. This is a cancerous tumour of the brain which affects an area of the brain called the cerebellum.
He wasn't walking, when we were diagnosed with brain tumour. He lost his balance and he was in.
Yeah.
He improved a lot, compared with the stories of other medulloblastoma children.
Sure.
He's a miracle now.
Well, that's good to hear. You must have, obviously, a lot of work for you and
of course,
parents,
there is,
having to do all this.
A lot of hard time,
Okay. He's done remarkably well. He's an extremely resilient child, and his parents have been very patient with all the treatment that he has needed. What time was his paracetamol dose?
At 2 o'clock in the morning.
2 a.m. Any doses since then?
No.
Okay. So, George, I'm going to check your temperature, okay? Can I see your hands first? Show me your hands. Great. Oh, you can do high five. Brilliant. That's good. All right, can I check your neck in the back? Yeah. It's mainly checking for the glands here. Good. All right, I'll have a look in his ear. All right, so I'm going to have a look in your ear now. Is it hurting you?
Yeah.
Which one's hurting you? This is hurting you? No, this won't hurt you. Okay, so this is the one that had discharge.
Yes.
Yeah, so there's kind of mucus coming out.
Yeah.
You can see.
Yeah.
Does this happen often? Or...
Since the chemo, that was the 6 months back, the first time it happened.
With chemotherapy, we always have to take extra caution as the risk of infections can become more complicated as the immune system can be much more ineffective and suppressed. When he was on chemo, did he need many courses of antibiotics?
Lots, yeah.
Just as a precaution, because obviously there might be some resistance to some of the things we could give. Do you mind if we just get a swab from the ear? It's just a small cotton bud.
That's fine.
It won't be painful.
That's fine.
Okay? I should have some in this room. Right, so I'm just going to tickle your ear. That's it. Good boy.
Good boy.
You're a good boy. okay, good. So I'll give you the prescription. And it's 1 spoon, 5 ml, 3 times a day. Okay?
Thank you.
Good. Okay, George? Take care. Bye-bye. Bye.
Okay, thank you. Bye-bye. Bye. No. I'm going to lunch in 5 minutes.
Have a biscuit.
I don't want a biscuit.
We've got raisins in. One of you 5 a day.
One of you 5 a day.
No, one of you 5 a day.
A day. A day.
Oh, how do you say it? Day?
Day. Day?
Day?
You sound so common.
I know, yeah. They put me all around the place now. You know, change is as good as a holiday.
It is, isn't it?
What do I do for you?
Basically, I took my shoes off yesterday from work.
Yep.
And the ball of my foot,
Yeah.
I went to walk on it.
Yeah.
Can't put hardly any weight on it.
Really?
And by the looks of it, on that side, it's all swollen.
So if I press on the bone like that,
Yeah.
you're okay.
It's not too bad. You know when you stretch your muscles, when you're having a stretch.
I do that.
That's when it hurts.
Is that hurting up underneath here?
Yeah.
So if I press in here,
That is hurting.
okay. I don't have a foot with me,
Yeah, yeah.
but I'll quickly show you what's happening. If I can find a piece of paper. Here we go. So these are your leg bones coming down here. Underneath that, you've got a funny bone like this, and that's where the rest of your foot normally comes off from. And under here is your heel bone sticking out. Okay?
Yeah.
So that's your heel bone there, and these are your toes down here.
Yeah.
To keep, you've got an arch in the foot, haven't you? It's meant to be a bit like that.
Yeah.
And to keep that in place, there's a piece of tissue that runs from just under the bottom of the toes all the way through to there, and it's trying to keep that in a nice curve.
Yeah.
Okay.
Yeah.
Sometimes you do something and it inflames that bit there, gets really sore, and that's where I'm pressing. So I'm pressing right on that, and that kills you.
Yeah.
And it feels like putting it almost like having a stone in your shoe, isn't it? You just think, I can't put that down.
Yeah.
So it's called, there's a big name for it, called plantar fasciitis, okay? So there are 2 sorts of exercises that you need to do, okay? One of them is to stretch that calf muscle, okay? And that's the one where you put your foot against the wall and you stretch it and stretch it. And you need to do that all the time, okay? And the other one is to get a tennis ball and you put it on the ground.
Sounds silly, but it's not. Yeah.
Yeah, and you just roll it underneath that foot just to try. You're sitting down. Don't stand up and do it. Okay, you fall over. I'm going to give you an anti-inflammatory just to try and reduce some of that inflammation. But the other thing you can do is if you go to a pharmacy or you can get it online, there are things called Sorbothane heel pads. Okay, and they're like a gel pad that you put in the shoes. Okay, and it cushions that area.
Right.
Okay.
Yeah.
So that's what we're going to do. I'm going to give you the anti-inflammatory.
Yeah.
You do the exercises,
Yeah.
and you see if you can find those. I'll write it down.
No problem.
Sorbothane. And you can keep my picture. Even Van Gogh had to start somewhere, didn't he?
Yeah.
And this may be worth a fortune. You never know.
You never know.
There we go, Jules. Okay.
Thanks very much.
You're welcome.
See you
See
later.
you in a few weeks. Yes.
Yeah.
See you later. Bye-bye.
Right, I'm going to do an impression of you, okay?
Go on, do me.
Right, darling. Got an appointment, lovey. Is that good?
You get me in trouble.
Pauline Hiran. Hi there. Come and have a seat. Hi. How are you?
Yeah, it's still not right.
Okay.
It's not 100% right. I keep sending a letter. They give me, Dr. O'Donnell prescribed them, but he hasn't put them on a repeat prescription. For my tummy, the Lanzaprolol.
Okay. How long have you been taking it?
Oh, quite a while now. Mm-hmm. You know, when it's terrible heartburn, and when it really does get to her, they just are brilliant.
Do you get heartburn every day?
Yes.
You do. Bowel problems?
I have got IBS. I
Okay.
have got, yes, I have got.
Any problems with bleeding when you're opening your bowels?
I've got piles as well, and they bleed sometimes, and sometimes I think it's just my piles.
Okay.
9 times out of
Is
10.
it bright red blood?
Yeah, yeah.
Any
Yeah.
blood mixed in with the poo? Or black poo?
No, I don't really think it's black.
Okay. Is it or not? I don't know what as such means.
I don't really examine it.
No, but you've not seen black poo.
You would have said if you'd seen Pauline, you would have.
Darker sometimes more than
Yeah.
other times.
But it's
don't
gone
you?
brown, has it?
Yeah.
Okay,
Yeah.
so brown is okay. Black sometimes means there's blood that's been altered that's mixed in with it. So it doesn't sound from your history like you've had that.
Yeah.
Okay, all right. And any weight loss?
Well, yes, I did, but I'm hoping to put it back on. I did put that down onto the thing.
Was it intentional weight loss?
No,
or
it
without
was not.
realising?
My sister died.
Right. Gosh. Okay.
But I don't know if I put it back on, but I was very pleased I put on this pound in a year.
Okay.
Whatever.
So you haven't put much weight on, but you'd lost it after quite a stressful time, hadn't you?
Yes, and then she's had cancer too.
Right. Okay.
Yeah, I've got the all clear in October, so
Okay.
it was all it's all been quite stressful. Probably the last 3 years really. But it's all looking good now,
Good. With this stomach, this acid problem that you're getting, though, is it okay if I examine your tummy?
What now?
Yeah.
Yeah,
And
no.
can we do a back passage examination as well?
Oh my goodness.
It involves inserting a gloved finger into the back passage to see if there's any blood or if we can feel anything abnormal there.
What's the date of birth, please?
So I get you to roll over to that side, but don't fall off the edge. Just be very careful.
Yeah. Oh, right up, isn't it?
And just bend your knees up as much as you can. That's fine. And I've got some cold gel on a gloved finger, so it's going to feel a little bit cold, but it should not feel painful. Okay.
Okay.
Okay, so I can see the pile there, sorry. Just deep breath in. Sorry about that.
Right.
Yep, so I can just see a pile and that's it. I'm going to wipe that gel off. And I'm going to leave some tissues there for you and you can get dressed and come and have a seat.
Well, I wasn't expecting that.
Bin's just there.
Did you only see one pile? I thought I got...
Yes, there might be, I mean, you might have some further higher inside, but there's one that's sticking out a little bit, and that's probably the one that's bleeding because it looked red.
Yeah.
But there's nothing else abnormal from examining you, okay?
Oh.
Are you okay?
Yeah.
Okay. Now, sometimes when you're getting a lot of acid that's causing this heartburn symptom, it's because of a bacteria called H. pylori. Is that something you've heard of at all?
No, it isn't. No.
So this bacteria can cause the acid burning symptoms, and that bacteria can actually be eradicated altogether with 2 different types of antibiotics and one of these tablets that protects the stomach, like lansoprazole. To check for the bacteria, we can get you to do a poo sample and bring that into us. And if it shows that it does have it, we can eradicate it. And if it doesn't, we might need to send you for another camera test to have a look, because it's been many, many years, hasn't it?
It has.
Okay, so that's the form to bring back with this. Okay, so that's for you to take away with you, and then we'll be in touch about the results.
All right, thank you very much.
All right, take care then.
Thank you very much.
Bye-bye.
Thank you.
So how are you feeling since the discharge?
Overall, much better.
Okay.
They gave me the results straight away and said basically there wasn't anything wrong.
Yeah.
So I was pleased with that. Good.
Yeah.
So, how are you getting on?
All right. I had my first meal yesterday, my first poo.
All right, okay.
My legs were like jelly. She sent me to bed for the day on Friday, and Saturday, by mid-afternoon, it was all right again.
Your blood pressure is much better today. Don't know, you're very happy, I don't know. It's around 130/80 at the moment. Yeah, so that's good.
Right. I'm good, thank you. I've got Kerry with me. It's Kerry's,
How are you?
Kerry's first day with us.
Hello.
So, how's this leg?
You're going to be in for a shock.
Am I? A good shock, I hope.
A good shock.
A very good shock.
Oh, the cream's worked then, has it? Oh, good.
It's what you call lovely jubbly.
Excellent.
Oh, yes.
That's what we like to hear.
Oh, it's been bleeding. Gungy, gungy.
Let's give it a little clean.
It's been a while now, hasn't it, since I've had this?
Yeah.
Oh my, it's all gone.
Look at that.
Fantastic.
That's
Oh,
lovely.
that's brilliant. That cream is brilliant, isn't it?
Yeah.
Yeah, such good stuff. And it's even helped, even the ulcer, that's totally dried up and everything now. It almost
Yeah.
looks like normal skin.
I've still got all my bruises still. There's one there, look.
Wow. Oh, that's brilliant.
Lovely, isn't it?
So you've had a week of the cream now, haven't you?
Yes.
So what do you think? I mean, I think maybe just another few days of it. Yeah.
Well, it's looking lovely now.
Excellent. So I just need to give you a couple more pads then.
Okay, thank you.
They're the smaller ones, aren't they? They're not these ones here. So you've got an appointment on Thursday then?
I've got an appointment Thursday, so
So
I've
just
got
to
two
check.
for next week.
It's lovely, isn't it?
Isn't it?
Yes, I'm happy.
Good. So you've been partying all weekend again, like you did last weekend, or
No,
No,
this
no.
weekend.
You've had a
rest.
Oh,
We
it's
had a
lovely,
50th,
isn't it?
70th, and then a 60th.
Yeah.
So
Yeah.
we had 3 on the trot. 50,
Yeah.
70, 60.
Yeah.
So you had a quiet weekend this one
Quiet
then?
weekend this
Yeah.
weekend.
No more
3 weekends
partying.
on the trot's enough, thank you.
No more diet.
All right. Oh, well, I'm really pleased that that's getting better there, Jonathan. So.
Yes, thank you very much.
All right then. Take care. Take care. Bye bye.
Lovely, thank you so much for your help.
It's okay. There you go.
Brilliant.
Take care. Bye.
All right. Take care.
Is that hurting you?
Yeah.
The heart is not designed for beating faster and irregular, and at some point it'll give way.
I've got to do something, haven't I? I don't want to have a stroke or a heart attack.
Yeah.
Heavens.
I have a very great worry that I don't want to go blind because I've seen my mom go blind.
So where do you feel the lump? Here.
And when you press it, I can feel it. And that's why I was panicking.
If you just hold her hand, that's fine. Even though I know it's a bit of a struggle.
Okay, thank you. Bye.
Hello. Hi, come on in. So, how are you doing?
Disaster.
What's the problem?
Oh, it's just everything. Everything's going wrong. My dog seems to be dying. Can't do anything about it.
You've been
Well,
seeing about...
he's 17, so.
Oh, okay, but it's still sad.
But he's incontinent. He keeps having accidents in the house. And I don't know, I sort of think, well, he walks about and loves his dinner. But am I being fair, you know? But I'm putting up with it at the moment.
You can talk to the vet, yeah?
Yeah. And then my neighbour's just doing my head in. Parties nearly every night. They're out in the garden. There's just no peace and quiet at all.
You're going to do something about that if it's causing you stress, yeah?
Oh, it's just doing my head, honestly.
Any thoughts of moving?
Well, I've spent so much. I've spent thousands in the garden.
You need to take control of that one, don't you, David? You can start to get some help.
Yeah, so my blood pressure has sort of gone out the window.
Have you been checking your blood pressure at home?
Last time I checked, it was 192, so I put it away.
Let me do it today.
Is it an urgent appointment?
No.
Okay.
Come in, take a seat. How can I help today?
I'm sorry I didn't check in.
Yeah, don't worry, I didn't know you'd hear.
Well, there was something that's been bothering me for some time. It started a while ago. I started getting like hairs here, and now it's like they're getting longer on my chin as well. And they told me that there could be something wrong with my hormones or something. So I just thought.
How long have you noticed the problem for?
This started like maybe more than a year ago, but now that the ones on my chin are getting longer and like here.
No, but how
also they're
long?
getting-
I mean, time-wise, are we talking a month, a year?
Oh, more than a year.
Okay. Any problems with your periods?
No.
Regular? Okay. So there is one condition that's associated with facial hairs, although you don't have any other symptoms of it. It's called polycystic ovarian syndrome, and it's basically when you have high levels of male hormone in the blood. We can check for that as a simple blood test. Okay.
They've also told me that this could happen if you have cysts.
Yes, that's exactly polycystic ovarian syndrome. It's the same thing I'm talking about.
Oh,
yes,
okay,
that's
okay.
right. So it means cysts in your ovaries,
Right,
and they often produce this high concentration of the male hormone testosterone.
Also, the blood test will show if. Oh,
Exactly.
Okay, good.
Yes. Yes.
Right, thank
you happy to have that test done?
Yeah.
Okay.
Have you ever had talking treatment? Talking therapy?
No, I haven't.
How would you feel about talking to someone about your stress levels?
I wouldn't mind, I suppose.
They'd start with a telephone call to you, and sometimes they do it all on the telephone. Would you be all right with that?
Yeah.
You're taking your pills, aren't you?
Yeah.
I have to ask. I'm sure that everything you've been telling me about isn't helping with this, but with your history, we can't leave it this high. In your case, we need to take no chances, yeah? Have you had your bloods done? Have you checked your calcium levels and your vitamin D?
Yeah, I think so, a little while ago.
I'll put some bloods on the system, okay? And I'm going to give you a 10 milligram bisoprolol. We're going to get you back next week to check your blood pressure, okay?
Okay.
And I'm going to do a referral to get you some talking therapies, okay?
Okay.
Good.
Thank you, Dr. Borgia.
No problem. You take care.
Sorry to move.
Don't be silly and make those calls, yeah?
That's it. Yeah, I will do. Thank you.
Bye-bye. Have a seat.
A few days ago, my boyfriend, he just noticed I have a lump in my breast. As you can't really feel it, but it's quite hard and it's small.
Okay.
So I rather to come and check. It's only because my father, he died on cancer 6 years ago, and I'm quite anxious with that. So
Yeah, sure. Okay. So you've never noticed anything before? Do you normally check your breasts? Yes. Okay. And you've got no pain or discomfort?
sometimes I can feel but before
Yeah.
period, and
Sure.
but
And your periods are regular?
kind of.
Okay.
Not very regular, but
Sure. And you're otherwise fit and well?
Yeah.
Yeah? Any change in weight recently?
No.
Any family history of breast problems?
Not as I know.
And you said your father died of cancer. What cancer was that?
Throat cancer, and after it was spread. And my mother, she had the cancer of the woman's stuff.
Okay.
And after she had the cancer over here, but
And how old was she when she had that?
45.
Okay. Chances are it's likely to be benign, non-serious, but even if it is, it means that it can be sorted quickly because you've identified it quickly. So you've done absolutely the right thing, okay? But try not to worry, okay?
Yeah.
Good morning, cancellations.
Good morning.
If you hold the line, please.
What's your date of birth?
Who's next?
Because your doctor's actually left now.
Who's next?
What time was the appointment?
10 o'clock, darling.
So it's with Dr. Hyder, yeah? Take a seat next door.
Take a seat in the waiting room, please. You got an appointment, darling? All right, lovely, I'll arrive.
Okay, so you're basically looking for any differences between both your breasts and see if anything your skin tethers in or anything like that. And then you lie down. So just put your hand behind your head. So pretend you split the breast into 4 parts, and then you just basically work your way around each part, just having a feel. And just many lumps. That feels good. Okay, just for that. So where do you feel the lump? Over here. Not sore?
And when you press it, I can feel it.
Hmm.
It's not a pain as, very much, but it's like, that's why I was panicking, because I always make sure everything is good. And obviously when my boyfriend, he checked a few days ago, I was really surprised. It's something.
It's very little there, the knees where you probably...
But if you press it much, it's really painful.
Is
So,
it?
yeah.
Okay. Okay, definitely something there. That's fine. Get yourself dressed. Give me a shout when you're ready. Okay, so there's definitely something there. It's very small though, okay. I do think we should get it checked out, okay, so I'll refer you to the breast clinic. They will see you within 2 weeks. I don't want you to worry, okay.
Oh, I'm worried already, but...
Oh, okay. Common symptoms of breast cancer are a lump in the breast, perhaps noticing a change in the size of the breast, or finding a lump in the armpit. Pain is not normally a symptom of breast cancer. However, if women are concerned about pain in the breast, then they should definitely talk to their GP. So they will contact you definitely within the next 24 to 48 hours for an appointment, and you're available for an appointment within the next 2 weeks.
Perfect.
Yeah?
Because if not, I will,
No, if you don't hear anything by the end of next week, you definitely need to contact our patient services team here. Really important that you do that. Okay?
I will do.
In the meantime, try not to worry. Okay?
I will do.
Most likely things are all okay, but we should get it checked out.
Oh, yeah,
Okay.
of course, definitely.
All right, take care.
Lovely. Thank you so much.
Bye-bye.
Take care of yourself.
You too.
Now, you've been sent to me because of
My right arm.
your arm. Okay,
Yeah.
tell me what's been happening.
It's been really painful, and I found my fingers were swelling up. I had to take my rings off, and I'm getting pins and needles all across there. It's really painful around the elbow.
So if you had to point to an area which was the most painful, where would you
Around
point?
here.
Okay, just down to that muscle
Yeah.
there. Now, if I feel up here, is that the pain?
Yeah. Yes.
Okay. So this bit here,
Yeah. I'm doing that.
well, if I hear the right spot, I always like to show it.
Yeah.
Okay, so that area, if you think about your arm here, and you've got lots of muscles that run down this part of the arm into your hand, all of those muscles then go into one tendon, okay, and they insert into that bone there, okay, which is really, really sore at the moment. If you played tennis, we'd call it tennis elbow. There are all sorts of things we can do about it, okay? And I'm going to give you some exercises to take home as well to try and do some exercises with it. I can tell you about a thing called a tennis elbow band, which you can pick up from one of the pharmacies, okay? The thing I can offer you today is an injection, okay? And that's up to you whether you want to take that or whether you want to try the other things first and see how it goes, okay? The injection is not curative. It doesn't stop the problem. It reduces the inflammation in that area, okay? And I think doing things like the stretching exercises and the strengthening exercises that I will give you is probably the mainstay of treatment. And sometimes we will then send you on to physio to promote that even more, okay?
Okay.
Would you like me to go ahead with that?
Yes, please. Yeah.
Okay, right, I'll get it ready.
Okay.
Hi, this is Monish. She's a medical student. Have a seat. Right. And this is Sophia.
Yeah.
Yeah, and we were just sort of talking because we had a little look through. She was here a couple of days ago.
Yeah.
Right, so
It's
tell me what's
7
been
days
happening.
now since
Yeah.
she's been having fever, cough.
Yeah. Yeah.
Last time when I came in, and doctor says if anything gets worse, just bring her in. So this morning I found that her breathing was hard, like she's struggling in breathing.
Yeah.
Fever is still the same degrees, yeah.
What sort of level?
It was 38 sometimes and 38.5.
Okay. And we know she's got this problem with her heart still. Is she drinking okay?
She's drinking, yeah, okay.
Sophia's got a heart murmur caused by some backflow of her blood from one chamber in the heart to another, and it makes the heart have to work harder than it would do normally. Apart from her problem with her heart, she's got no other problems that I can think of, and no allergies?
No.
Okay. Should we have a little look at her?
Yes.
Okay, that's good. Okay. Hello. Oh, sweetie. I'm sorry. I'm just going to put this in your ear. Okay. I'm really sorry, sweetie. But you just hold it. I just want to check. Oh, sorry. It's just. I tell you what. Listen. Okay. Listen. That's all right. Okay. I think what I'm going to do is I'm going to try and listen in now, anyway, because I don't think she's going to stop. Oh, sweetheart. I'm sorry, sweetie. I'm not going to bother with her temperature because it's going to be very high, but I do want to have a quick look at her ears, if I may. I'm sorry, sweetheart. If you just hold her head, that's just the head on it. That's fine. You can hold it. I know it's a bit of a struggle. Excellent. Sorry, that's all done. All done. Look. What's this? It's all done. It's all done. It's important that when children come to see the doctors, they go away feeling happy and content because they'll come back again the next time, not traumatized by the experience. If parents can talk to them about it, explain, then that helps demystify and helps reduce the pressure children feel under when they come to see us. I'm really sorry. Right, she is a poorly little girl. Her breathing at the moment, the rate of it, I'm quite happy with, and the ribs themselves aren't going in. But you're right to bring her back for us to look at her. It does sound as if there's some noises down in this area around the chest, which is different to the other side. It's a little bit sort of noisy, a bit rattly. It suggests to me that there is a chest infection starting there, which is why her temperature's still going up and down and why she's sort of struggling a little bit more. I feel she would benefit from some antibiotics. The proviso is, if she starts getting any of her ribs going in, or her breathing gets worse, or her nose starts going in and out, then you need to come either back straight away here, or take her straight away to hospital. Okay? Does that sound okay?
That's fine, yeah.
Okay. Okay.
Thank you so much.
You're very welcome. As I said, even if you have to bring her back this afternoon, don't feel that you can't. Okay.
Thank
Okay.
you so much.
Not at all. Take care. Bye-bye.
Bye.
Bye.
So the object is to find that spot. I pop a little injection into it, okay?
Okay.
Tell me when I find that spot.
There.
Prick now. It is a painful injection.
It is. I don't think so. You think of injections as an injection. No.
There we go. Just put a bit of pressure on that for a moment.
Okay.
Okay, just for a couple of minutes there. Okay, so this tells you all about it. Okay, it gives you some simple exercises, tells you a little bit about the sort of elbow grips that you can use as well, medication. So when that settles down, okay, I want you to start on the exercises.
Right, okay.
If you want to, then go and purchase one of those tennis elbow bands as well.
Right.
And let's give it the next 2 or 3 months and see how you get on.
Okay then, lovely.
Be prepared for the next few days. I'm sorry.
Thank you. Okay, thank you.
Bye-bye. See you later. Bye-bye.
How can I help?
She's got temperature for the past 2 days.
Mm-hmm.
She's got some problem with her tongue.
Tummy.
She's complaining of ache and
Okay.
she's farting and it's aching with farting.
Okay. So how long has she been unwell for?
2 days.
She's got a temperature now,
Yeah. We've given her Calpol at 4:30 this morning.
Her glands are all up as well. So she's had a bit of diarrhea. Any cough, cold, sore throat, or anything like that?
She's got runny nose a bit.
You go, my neck will go. Make the noise. Okay. Is it sore at all?
Yeah, it hurts.
Hurts, okay. Do you want to jump up on there and we'll have a feel of your tummy? Your tummy pain, when did it start?
When did you start with the tummy pain?
It started yesterday.
Where did it start? Can you point?
There.
There. Is it still the same place or has it moved anywhere else?
It's not hurting anymore.
It's not hurting anymore. Okay.
But it's just,
When did she last have diarrhea?
Yesterday evening.
This evening.
Well, it hurts when you press it.
It
That hurts.
What about this side? No. It's probably a viral gastroenteritis. Okay. I'm just checking it's not her appendix. Okay. Do you want to just come and sit here? Yeah. I think we need to take one thing at a time today. Okay. I don't think this is anything more than a viral illness, and the problem is that viral illness will present in many, many different ways. From now on, though, Calpol, Nurofen, regular fluids, rest, and diarrheitis. She's getting lots of diarrhea. Get some diarrhea. I think she'll get better by herself.
Okay.
See you later. Bye-bye.
I live 5 doors away from my first husband. We went out for a month, engaged by the second month, married on the third month, and we lasted 17 years.
Wow.
You've got to grab it while you can.
Absolutely.
Don't get here.
You are mine. Mrs. Khan, please. Very noisy out there, isn't it? How have you been? I've been fine. More to the point, how have you been? Come on and have a seat. Have you been travelling again?
No.
No? You've been at home? It's not like you.
I've been at home because not feeling too good.
Okay.
Now this is the result of my eye test.
Diabetic screening.
They found something, but it's not
Very
serious.
mild. Yeah. But they want us to keep your diabetes under control, I'm imagining, yeah?
Yeah, Dr. Boja, I'm trying my very best because swimming is the only thing that I can do.
So you're swimming regularly, yeah?
Every day.
Perfect. And you're managing that? Your joints are coping with it?
This is the thing that is happening
It's a vicious circle, isn't it?
Yeah. I'm getting pain here.
In your foot? Tender?
Yeah.
Probably a little bit of wear and tear in there, I'm afraid. So maybe you're doing a little bit too much. Maybe
I'm not jumping.
Is it worth thinking about pulling back on the swimming a little to see if that helps with the ankle pain? It might be that it's sensible maybe to take a little bit more of the painkillers and reduce your exercise. I hardly ever say to reduce exercise. It's fabulous that you're doing that much. And if necessary, take some more of the codidromol. You're taking the lixisenatide and the saxagliptin. You're taking the metformin twice a day?
Yeah.
And you're taking gliclazide?
Yes.
Okay. You're on the maximum of all of that.
Yes.
Yeah?
Yes.
The difficulty is what we would add next, yeah? And what we would add next would be insulin, and the trouble with insulin is it will put weight on you, yeah?
Okay.
So I think the sensible thing to do at the moment would be to watch at this level because your sugar really isn't disastrous.
Dr. Boja, I have a very great worry that I don't want to go blind.
No.
Because I've seen my mum go blind.
Right, Mum's hearing aids broke, so she's
My
got
hearing
a drop to
aids
ear.
broken.
Oh dear.
So,
That's okay.
so I'm absolutely deaf as a post.
Oh dear.
So is it both ears?
Ears, yeah, just...
Both of them?
Yeah, blocked right out, I can't...
I think I've dislodged something and I can't hear nothing in my left ear. It was quite sore the day after as well.
What did you put in your ear?
Cotton buds.
Oh dear.
The no-nos.
she's got a blocked ear.
Okay.
She's had it about a week. I think it might need syringing.
Okay.
It's so blocked that she can't hear a thing.
Okay.
And then it pops.
Okay.
And then it...
What kind of ear?
Okay.
I hear better in one ear than the other, but that has been for years because I just don't like it.
Yeah.
I don't want to have to be wearing hearing aids.
Yeah.
I hope it's not to that degree.
Past week or so, it's just got worse. And,
Yeah.
Well, I can't hear the wife. That's pretty good.
Oh dear. So I'm gonna leave them the way they are then.
Yeah.
How can I help?
I've got a swollen right ear.
Okay. When did it come up?
Bank holiday Monday.
All right. Has it ever happened before?
Yes, it has. It usually goes over my face.
Any other symptoms with this?
A bit tired.
Any problems with your hearing?
No. No. I used to be partially deaf myself, but it's come back.
This in the good side. Have you got itching in that ear?
On bank holiday, it felt like it was like a toothache.
Okay.
Like throbbing.
Yeah.
And I felt like chopping it off because it was really raw.
Look at this one. Is this causing you pain?
Not really.
Okay. Fine. So the canal is narrower than the left side.
Okay.
Do you use cotton buds at all?
No, I don't. Okay. No.
And have you been swimming or anything different recently?
No.
No. Okay. Fine. I mean, it does look like there's inflammation in the right ear. So we sometimes call this otitis externa. But equally, what's confusing is your history before, but whether this is another version of that swelling you used to get.
Oh dear. But this morning I felt like there was a lump coming here on my side of my face here.
Right.
And I thought to myself, oh God, don't start, it's going to come over.
Touch that here? Okay.
Yeah.
Okay. I would still take your fexofenadine, but given that you feel this is different, I'll treat this as otitis externa, which would be giving you an antibiotic, if that's all right.
Yeah.
I think flucloxacillin would be an reasonable one to take.
Do you think it's food allergies then?
Have you found any foods that trigger this?
See, what it is, I had, went to the Chinese place and I had some prawns.
Yeah.
But I've had prawns before, but it's never acted. But because it's got soy sauce and other stuff.
Yeah, obviously the clear-cut ones are the ones where people have nuts and things that can be hard to avoid in foods.
Yeah.
But with some of the additives, it's difficult.
Yeah.
But with this came on spontaneously, is that right?
Yeah.
Okay. So that's the antibiotic and that's your usual fexofenadine.
Okay.
I hope this subsides.
And
Obviously,
both of them are tablets?
both of them are tablets.
Tablets,
If it spreads to involve the
Your
eye
face.
area, then and you're worried, then do come back.
Yeah.
But I'm hoping that won't happen.
I hope
Okay.
so. We're touch
All right.
wood.
Take care. Bye-bye.
Okay then, thank you.
I'm quite careful with my diet because I've seen my mum going blind.
Okay.
So I don't want that to happen to me.
And I think you're doing everything to minimise the chances of that.
Okay.
Yeah?
Yeah.
I couldn't ever say to you it won't happen, but from where your eyes are now, really, you know that you're a long way from anything like that.
That's why I'm keeping to my exercises and everything.
Diabetes can lead to blindness in a variety of ways. Diabetes affects the blood vessels on the back of the eye, and this can cause bleeding into the eye and can also cause some swelling in the eye, all of which can contribute to a loss of vision. The most important things you can do are to control your blood sugar, to control blood pressure, and to make sure your cholesterol is where it should be.
Try not to worry. I know that's really easy to say and difficult to do.
Because my main concern is, I don't want to be a burden to anyone.
Sure you're not. No?
I'm not at present, but in future...
You're being proactive.
Yeah.
Good. Right. So, keep that for your records.
Yeah.
And you'll come back for a blood test in 3 months' time for me?
Yeah.
Good.
Thank you, Dr. Bolger.
No problem. Nice to see you.
Nice to see you too. You take care.
Bye-bye.
Okay, bye-bye.
Kenneth Wright.
Hello.
Morning.
Come through. Have a seat.
No.
No?
Is that you?
That's me.
Oh, I thought it was the chap with the...
Oh, he's on leave.
Is
So
he?
I'm sorry to disappoint.
No, this is you, is it?
This is me.
Yeah?
Yeah. You're
Yeah.
registered with me.
Yeah, I am, yeah.
Yeah.
Anyway, I'm here for the results of the blood tester.
Yeah, okay.
We were doing see how the B12 had settled, and...
Well, you're no
the
longer
thyroid.
anemic. Your haemoglobin level's okay. And your B12 levels, the range is from 180 to 700.
Yeah.
And yours is over 1,000 now. So you're well topped up, I think. So I don't think we need to give you any more B12. Yeah?
And the thyroid?
Yeah, not so good. Can I just check you're not taking thyroxine?
I'm not taking any tablets at all.
But you were on thyroxine.
Yes, yes.
And why did you stop it? Can I
Because
ask?
I didn't like them. They weren't doing me any good. They were doing me more harm than good. You know, I don't like taking pills at all. I haven't taken any tablets at all this year.
Can I ask how you're feeling at the moment?
Well, I've got this tiredness fatigue.
Yeah.
And nothing is doing anything for that. I've lost my drive, you know.
Okay.
so
And how
to
long is
speak.
that? How long have you been feeling like that?
Well, it must be all this year, definitely, yeah.
Right. Okay. So do you think there might be a connection?
No.
It seems like you stopped the thyroxine and you started to feel a little bit more tired and a little bit not have the get up and go. So there may be a link. If we tried it again on a lower dose, it may make you feel better.
Well, we'll go 25 then, yeah?
Okay, so we'll go 25 and then we'll do a blood test in 2 months and then I will personally look at the results and see where we're going.
Okay.
Yeah?
Yeah. It's nice to meet you and
And-
thanks for your time.
No problem at all.
And thank you very much.
No problem,
indeed.
take care, bye-bye.
Yeah, thank you.
Too many people in this surgery, I can't keep up with it.
Can't keep up.
Elise, tell us, please. Elise? So, what's happening?
Pain in my chest
Mm-hmm. How long for?
since sort of yesterday, late evening.
Yeah.
Now, I haven't slept very well because pain, I couldn't get comfortable with it.
Yeah.
If I take a deep breath, it hurts even more.
Yeah.
If I move this arm this way, it
You
hurts.
can really feel it.
Yeah.
Okay. Right there. And you can feel it when you do that.
Yeah.
So if I press on that, okay, that's really sore. Let's have a quick listen to see. Deep breaths from me if you could. In and out. Good. Does it go through to the back at all?
Yeah.
Yeah. And every time you move this, then you can just feel
Yeah.
it like a stabbing,
Yeah.
sharp, really sore pain. What do you do for your job?
A supervisor at a care home for the elderly. So it's quite manual work.
Do you know what you need to do? You need to do more supervising.
Yeah, rather than the manual part.
So you've got something called costochondritis. Have you ever heard of that before?
No.
Sounds a lot worse. Well, it sounds a lot worse than it is. It's not dangerous, okay? But it just feels as if somebody's crushing your chest at the moment, doesn't it? So you've got a breastbone that goes down the middle. You've got ribs that come from the side, okay? And in between the ribs and the breastbone is cartilage, okay? And as it gets lower down, you've got more cartilage. So what you've got is an inflammation between the cartilage and the rib, okay? Often it is a viral type thing. It comes along and affects it. It doesn't have to be. Sometimes we have no idea what starts it off, okay? But it's extraordinarily tender. You can press on it and you just double over in pain. Take your deep breath. Of course, that increases, so that starts to pull it apart, causes a lot of pain. Move your shoulder. Causes a lot of pain, all of those characteristics. It does go away by itself, okay, but it may take a bit of time. It may take a week or two, okay? So I need to give you something reasonably strong to help it.
Okay.
Costochondritis. Yeah, it's a great word. Yeah, there may not be an H there. I can never remember, but that's one of those things.
Okay. Thank you very much.
Okay, see you later. Bye-bye.
Bye.
how are you?
Went to the pharmacy to pick up the other
That's right,
prescription.
that's right,
And he woke up. And when he woke up, it was just...
Yes, I see. That's right, yeah.
Yeah.
And the other eye seems to be pretty good.
Yeah.
No. How are you? Well, I think it is worthwhile treating it because it is quite red and there's quite a lot of pus in it.
Yeah.
And my suspicion is that it's going to get worse. We don't treat these most of the time. They're viral.
Yeah.
Most of them, they clear up. But this looks to be something that's getting, has the potential to get a lot worse a lot quickly.
Yeah, yeah.
So we give him something just topical into his eye. And I would like you to use it for 5 to 7 days, depending on how you get on.
Okay.
We're going to give him drops.
Okay.
Yeah. It's highly contagious, so it's very important that you wash your hands after having administered the drops. And then bathe his eye, just rub it around with a warm compress, clean out the green exudate.
Yeah.
But not allergic to any antibiotics as far as you know?
No.
As soon as the pharmacist was trying to describe it, I knew it's something I had to see.
Yeah.
Because sometimes these can be fairly mild.
Yeah.
And sometimes you can see in the speed it has developed.
Yeah.
That's
How
right,
quickly
yeah.
it's come.
Good.
Thank you very much for your help.
You're welcome. Nice to see you. Bye-bye, Sebastian.
Bye.
Bye-bye. Thank you for coming in.
Are you feeling better?
Yes.
Okay, so it's just the medication that causes trouble to you?
Yes.
Okay.
I'm fine now.
You are very sensitive to any medication whatsoever, aren't you? That's what we've learned over the last few months.
I've tried everything before.
That's right.
Everything affects me, and I'm fine now. You know, but as soon as I go on those, I go down.
How much are you smoking now?
10, which means 15, I suppose.
10 would mean times 2, 20 for me. Whenever patients tell they smoke 10.
1.5.
Have you thought about quitting smoking anytime?
I do try. I've tried everything. Hypnosis, you wouldn't believe it. Alan Carr, I've spent a fortune.
Have you? Do you like smoking? Do you enjoy smoking?
Yes, I suppose I do, especially after a meal.
So you're aware that you're at risk of all these issues with the lung and the heart as well?
I know.
Okay.
But I can't take the tablets.
Yeah, let's put to bed the smoking bit. Help is available when you're ready to quit. We've got smoking cessation clinic running on Saturday mornings. That's something you can think of. Let's have a quick look at your heart and see what's going on. If you want to take off your cardigan. Just going to feel your pulse. Okay, I'm just going to listen to your heart.
Is it good?
I will let you know in a moment.
I've got a bad back. When you sit down, it's sort of like the shooting pains and stuff.
Okay.
It's really sore.
The pain gets me down. This last week was horrible.
It's the most horrendous pain that I've had. I'm just about to hang myself.
I've been getting quite a lot of lower back pain.
Okay.
And now it's getting to the point where it's actually quite bad.
I've suffered with sciatica for quite a long time, but it's getting to the point where it's getting unbearable.
Ah! There. Yeah. Okay.
Grab a pew there.
And I think you've come for a review about your back, is that right? Tell me what's been happening then.
I do suffer with my back.
Yeah?
I've done for a while,
Yeah.
for a long time.
Yes.
I've got prolapse L4 and 5 disc.
Okay.
I was making my bed, my back popped. On Friday I spoke to a GP. She gave me 2 milligram diazepam just to try and relax it, but it just got worse. My whole back here, this side is all locked.
Okay, let's have a little look and see. Let me just pop you up onto the bed a wee minute and sort of see.
This is the hardest bit.
Just laying flat, yeah. Right, I'm just going to lift this leg up for a wee minute, okay? Is that hurting you?
Yeah.
On whereabouts?
On the head.
On that bit, okay. Can you grab that leg and hold it for me? Now, if you can, try and pull it up and at the same time push down. Can you feel that sort of?
Yeah.
Okay. Just relax. It's in your sacroiliac joint, it's not your discs that's causing the problem.
Okay.
And that's where your spine and your pelvis join.
Right.
We need to sort of loosen that up. And the way to loosen it up is to sort of gently manipulate it.
Right.
Now, you can do some of that yourself. So what I was getting you to do there is part of it. Okay. Also, if you're sort of pushing down, gently, I know it's a wee bit sore, but that sort of starts to mobilise it.
Yeah.
The other thing you can do is if you bring the leg up,
Yeah.
like so, and then you swing it over around that way hard. Now, it's still quite sore, but if you did that, it'd be hard. I think you'd benefit from some anti-inflammatories around here to try and settle that down.
I can't actually take anything.
Are you worried about your problem with your stomach?
Yeah.
Yeah.
Because I've got a high exhale.
The best way would be to pay and see an osteopath or a chiropractor to loosen that up for you. Do you want a hand up or do you want me to let you get yourself up? I know how you feel, don't worry. It's not pleasant, is it? Do you want me to give you a little bit more diazepam as well?
Please, if that's okay. I've been quite lucky, actually. It hasn't played up for a long time. I was quite bigger. I've lost 11 and a half stone.
Brilliant.
So.
That obviously helps.
Yeah.
The heart is beating fast at the rate of about 110 beats per minute. And it's beating irregular.
What should it be?
It should be around 70 beats per minute.
So it's about 50% OT?
So normal heartbeat will be doing like this. Your beating is like this. Yeah. It's very irregular, very fast. So the heart is not designed for beating faster and irregular. And at some point, it'll give way, causing heart failure issues. And the clot that forms inside that small area called left atrium can get dislodged and cause stroke as well. What are your thoughts?
I've got to do something. I mean, I don't want to have a stroke or a heart attack.
Yeah.
Heavens.
Yeah. So you're smoking, your current diet, which you think is not great.
My diet is terrible.
Terrible, okay. So if you're okay with it, I'm going to refer you to the specialist in at the hospital. Is that okay?
Mm-hmm.
I'm sorry I could not have much help, but we'll see how it goes. Yeah.
Thank you.
All the best. Bye-bye.
I've come to see you about this hen again, yeah?
Yeah.
All this, pins and needle all the time. These three are okay. This one is some time.
Yeah, and
but this little one, look at that, it's permanently stiff.
Oh, right, I see. And let's have a look at this one.
Got no problem with this one.
So just make a fist on this one and make a fist on this one. Yes, okay? And open them out. So does this feel different? Does it feel numb?
Yeah, this one feels numb, as if I've got pins and needles.
I just want to put a little page of paper between your fingers like this. I want you to hold on to it, and I'll try to pull it away.
Between which one, these two?
No, these ones for the moment, yeah. Pull. Yes, good. And then I'm going to pull again. Good. And these two, going to pull again. Okay. So just take off your coat and your jacket.
What I'm worried about
Yeah?
is having watched all these programs.
Oh, yes.
You know when they've got to amputate your foot and it gets all black?
Diabetes, gangrene.
Diabetes, gangrene.
Yeah, no, this is not that. This is your ulnar nerve.
Yeah.
So you have nerves that roots come out of your neck.
Yeah.
They go under here. They then form a big plexus, and then out those come the nerves. And one of the nerves supplies sensation to this finger and half of this finger. And it's called the ulnar nerve.
Yes.
Somewhere between there and here, your ulnar nerve is being interfered with. Stand up for me for a sec. Put your chin on your chest for me. Good. And now put your head right back up. Throw your head right back. Okay, you're a bit stiff in your neck. And I think what's happening is the muscles may be trapping part of the ulnar nerve that's supplying this, and they may be causing it up here. It's happening between your spine here and your plexus under this muscle here. So take a seat. So it's not anything you need to be worried about.
That's fine.
It may recover itself. The ulnar nerve does more than supply sensation to these. It also supplies power to the muscles in the small muscles of your hand. Now, the interesting thing about you is that when you look at your muscles in your hand, they're still just as powerful as they would normally be. So I think this is going to be relatively short-lived because whatever caused it up here, I don't think will continue. But I think if you could do more neck exercises, like chin on chest, head right back, chin over your shoulder, chin over this shoulder, and do those movements maybe 3 or 4 times, and do that 4 times a day, it'll free itself. Yeah.
Thank you very much indeed.
Not at all. You're welcome. I just don't want you worrying about this.
Anyway, nice seeing you.
Yeah,
Thank
nice,
you very much
nice to
indeed.
see you, Ned. Yeah,
Bye-bye
yeah.
then.
All the best. You take care.
Bye-bye.
Bye.
See you soon.
See you later. Thank you. See you then. Bye-bye.
Thanks very much.
Take care.
Bye-bye. Thank you, and you. Bye. Take care then. Bye-bye.
Bye-bye.
See you later, guys. Bye. Hello, how are you today?
1 minute I'll be fine, the next minute I'll just be laying on the floor and then I'll lose consciousness as well.
I lose sensation in my fingers, sometimes my lips as well. That never used to happen when I was younger.
I just wonder, has there been kind of pus at any time as well?
Now it's more like some sort of thick, smelly pus-blood mixture.
Is it tender when I push on the chest wall here? Fine.
That's it, it's all.
Okay.
I'm going to give you some naproxen for a couple of weeks.
Oh, yeah.
A small dose, because you are 88.
Tell me about it.
Look how yellow that is. It's meant to be like really clear, isn't it?
Not clear, it's meant to be a light yellow.
It's like orange.
Reese Smith.
Oh, yeah.
Hello, Kelly.
Hello, back with this one now.
Hello, how are you?
Sit there. Give that
Right.
to Doctor.
Oh, thank you very much. I get all the nice presents.
I know. We were sitting there holding it.
So, what have you had done? He's had some surgery, yeah?
Yeah, he had a circumcision. He's had problems with his peeing for like the last couple of years.
And so they did a circumcision?
Yeah. Took the foreskin off, hoping that that might help the pee flow, but it hasn't.
Okay, so the pee flow hasn't got worse since
Yeah,
the
it
surgery.
has.
It has got worse. Is it hurting him to pee?
Yeah.
And before he had the circumcision, it was the same sort of thing,
Yeah.
lots of trouble passing water.
Yeah. And last night he was up and down and he's pushing and it's not coming out.
Is he opening his bowels?
Yeah.
He's not constipated?
No.
Because if he's constipated, that can cause problems with emptying your bladder, no?
No. You go every day, don't you, for number 2?
Yeah? OK, let's have a look at you then. Can you climb up onto the couch for me, sweetheart?
He drinks a lot as well.
Oh, wow. That's impressive. I don't think I could get all the way up there.
Hello, thank you for waiting.
That's okay.
Have a seat. We've met on the phone, haven't we? We haven't actually met.
Oh yes, that's right. Yes.
Hello, nice to meet you.
It's nice
Hello,
to meet
hi.
you.
Have a seat.
I've been having trouble with my ear for the last 7 weeks. I did see Dr. Shah, and she gave me some drops, which actually made my ear worse.
Okay, so
It's been bleeding.
Right.
It's been very itchy and very sore.
And the drops she gave you didn't help?
No, they never do.
When you say they never do, is this an ongoing problem?
Oh yes, I've been to the hospital and everything about my ear, and it is an ongoing problem.
And what do they say the problem is?
Well, they said it was something to do with my jaw, but I don't agree with that. I think
Okay.
it's something to do with my ear.
So how long has it been going on for, this trouble?
Oh,
Years?
since I was a child.
Oh, so
yeah.
just a couple of years then, not that long. Yeah. Okay. Let's look at the ear that's not trouble then, yeah. Is it going to hurt if I touch you? Does that hurt?
No.
Does that hurt?
No.
No. It looks okay. I can't see any bleeding. I can't see any sore. It looks a little bit sore compared to the other one.
Yeah. It's not been pouring of blood or anything.
Right.
It's just been like bits.
Do you clean your ears? Because they
Um,
look really clean. Do you use cotton buds?
yeah, but I don't go all the way in.
Yeah, you shouldn't go in at all. They're
No.
too clean.
Yeah.
That's the problem. The wax
Yeah.
is there to protect it.
Yeah.
And I would urge you to not put any cotton buds. The best you should do is get a flannel or a bit of tissue and just wipe your ear.
What it is, it's because when they were itchy, I put the cotton bud in.
Yeah, and you scratch it.
And it's an itch where you can't get out, and
Yeah,
it's really
I understand.
annoying.
So what happens is you get the itch, you scratch it with a cotton bud,
Yeah.
which damages the skin, which makes it
Yeah.
more itchy. So you scratch
And
it
that's
even
why it
more,
was bleeding.
and it makes it worse, and it makes it it's bleeding. Yeah. You got any moisturising cream or something?
No.
There's just something to just put in it, to just dab it on there,
Oh, okay.
and it might just ooze the itch. But don't go sticking it down or anything.
Because I thought the itch would be further down the ear.
It's probably just it's probably quite near the outside.
Oh, okay.
And that will just then the cream might soothe the itch without you putting anything in it, without you
Yeah.
scratching it.
Okay, thank you very much.
You're very welcome.
Doctor.
Thanks for coming in.
All right,
Nice to
thank
meet you.
Doctor.
Bye bye.
Bye.
Pull down for me, sweetheart. No, that looks okay, doesn't it? Nice and tidy. Does that hurt, sweetie? No? A little bit. What we were worried about was whether or not there was urine stuck in his bladder there. There's no urine there. You can see how my fingers go right in. His tummy would be really hard and you would feel the bladder.
But he goes up and down, and he's not sleeping.
Absolutely. Come back
so
across, darling.
he's
I'm not done.
tired in the morning when we have to go to school. He's shattered. And he's not sleeping till 12 o'clock. He goes to bed at like 9. And he's up and down, up and down.
Right, so I don't think that there's any urine stuck in there that isn't coming out, but obviously it's not right.
Yeah.
Looks a tiny bit red, but not obviously infected, but there's some white cells and some protein in his wee, so it may well be that there's an infection higher up and that's what's causing his problems. What we're going to do is send that off to the hospital.
Yeah.
And we're going to give him some antibiotics.
Yeah, that'd be lovely.
Lots of fluids to keep drinking. You're giving him some paracetamol for when it hurts?
Yeah, Calpol.
Perfect. OK. Is Reese allergic to anything? Is there anything he can't have?
No.
Now, if at the end of it he's not right, we want to see him again.
Yeah.
If the sample comes back showing he needs any different antibiotics, we'll be in touch, OK?
Yeah, and in the meantime, if you finish the antibiotics and it's still no better, we
bring him back, yeah? There you go, Reese. Do you want to take that off to the chemist?
All right.
Good boy.
What'd you say?
Thank you. You take care, OK?
Thank you.
No problem. Bye-bye.
This way, chemist, this way.
I blame it on the not running. As soon as I cut out the exercise, I've just gone. I need to get back into it. It's Saturday morning.
Why can't I enjoy it like that?
What?
Running.
Oh, I run weird. You know,
I
like
run.
Phoebe or
Phoebe,
Friends. Literally, watch.
Victoria's Panska, please. Come in, take a seat. How can I help today?
Yeah, yesterday she told me when she take her right hand up,
Yes.
in breast side, she feels something hard and pain.
Uh-huh.
You can show, doctor?
Any lump or is just painful?
And I feel something hard.
Okay.
Like something like, for example, like stone or something.
Okay,
I feel.
all right. Can you show me what you feel? Is it painful? How did you notice it?
Yesterday when she's sitting in the room,
Yeah.
she just put like hand. Sometimes she like put somewhere hand evening, and she told me she feels something hard, and when she touch, she feel pain.
Okay. Anyone in the family with breast problems?
My mother-in-law.
Mother-in-law, so her grandmother, yes?
Yes. Mm-hmm.
And what's the problem there?
She got breast cancer.
Okay.
There is this pain on my left knee
Left knee. When did that start?
about 2 weeks ago. It gives me feverish condition.
It's making you hot.
Yeah.
Arms to the side as far as you can go. So that's very good. And go to the front, all the way up. That's good.
Keeping this leg straight, lift it up for me. And drop it back down for me. And the other side for me. All the way up. Okay, drop it back down for me.
What happened then?
I was ice skating, did a funny twist, went right down onto my knee, and as I did, I went all the way around like this.
And you've never had any surgery, keyhole, nothing on that knee?
Bad hand, bad knee, 2 knees. So I tried cycling and just to lose weight, and then I fell off. So that wasn't a very good start.
Tell me about your knee and what's been happening with it.
Well, it started off, I had a car accident about 10 years ago.
Yep.
And when the vehicle turned on its side and my leg was sort of took all the brunt of everything, I got a little bit of swelling, but then it always went down.
Yep.
Never had a lot of pain.
Okay.
Anyway, I was playing football, twisted it.
Yep.
And then, I don't know if I was, because it was twisted, I was putting a lot more pressure on this, but then it came up, but as it did before, it didn't go down this time.
Okay.
And then
So
I
it
started
stayed up.
And I keep getting quite a bit of pain in it.
Does it ever lock on you to the point where it sticks and you can't move it? No. Does it click or clunk?
Yes.
Yep. Okay. Do you ever try and take anything for it to help it?
It's the usual stuff like the ibuprofen. And
Okay. Pop your shoes off. Pop your socks off. Come and have a lie there. Okay. Head back, nice and relaxed. Don't go to sleep. Okay, so this is the good one. So there is a difference in size. There is, isn't there? You know, doesn't feel any difference in warmth. Yeah, you've got a fair bit of fluid in there. It's a big difference between the two. Okay, let's bend that in. Bend it out. Bend it back in again.
Yeah, just a bit of clicking.
It's clunking and it's clicking and all sorts of things there, isn't it? The fluid does come into, this is called your suprapatellar pouch. When you get fluid within the joint, it sort of goes into there as well. So you can feel pain across the front here as well, but also down on that. The last one I'm going to do, I'm going to press down on that kneecap. I want you to squeeze these muscles really tightly and try and pull the kneecap upwards. So nice and relaxed. Off you go. What's that like? Yeah. It's quite painful. And again, is that the pain you get?
Yeah.
Right, okay, hop up.
Can I even get a sweep?
Sorry?
Can I even get a sweep?
No. A couple of things. You've got something going on in the joint. You've had an X-ray, but years ago, haven't you?
Yes.
I think we need to do another one. Okay. Even then, you had sort of mild arthritic changes, okay, including a change behind that kneecap. Now, that kneecap's really irritable at the moment, okay? Remember when I pushed down on it and it pulled up? You know, that's scraping the bottom side of that. So I think you've got a fair bit of inflammation going on behind there. And undoubtedly, I think within the knee, because you've got plenty of fluid in the knee too, okay? So I'm going to send off a referral form for a knee X-ray, okay? It'll take a week to get the result.
Thank you very much.
Okay, mate.
Happy days.
Good to see you.
Likewise, my man.
Take care. And let's avoid the vet.
Hey. See you again.
See you later, buddy. Bye-bye.
It's that, isn't it? Yeah. It's very hard, isn't it? Okay, good girl. Now put your arms all the way up. All right, so what we'll do is refer her to the breast clinic and they can check that out for her. It's quite firm. It might be part of the rib bone potentially. Sometimes you get cysts and things, but I don't think there's anything worrying. I mean, she's only 9 years old, but we'll just get it checked out.
Okay, fine.
Is that okay? So you should hear from the clinic. Usually takes a couple of weeks. They're usually quite fast.
No problem, no problem.
We'll just get it
can
checked.
wait.
Okay?
Okay.
Lovely.
Thank you. Bye-bye.
Bye now.
My back hurts, Gergen.
You know what I've done? I've made a mistake.
Gergen made a mistake?
Yeah.
No! I better write that on the calendar.
I know.
Gergen made a mistake.
I made a mistake.
Naughty girl. My back's killing me. Oh.
Hiya. Thanks for waiting. I'm Dr. Tawana. I think you've just recently registered with the practice, is that right? Welcome. How can I help?
Two things. First, my feet. Ingrown toenails on both big toes.
Sure. Do you mind if we take a look? How long have they been troubling you for?
They've been steadily getting worse, so it's hard to say when they got as bad as they are.
Goodness.
On the order of a year, certainly.
It looks quite red and sore at the moment.
Yeah.
I just wonder, has there been kind of pus at any time as well?
Definitely this time last year there was. Now it's more like some sort of thick, smelly pus-blood mixture.
And is it the same kind of picture on the other side as
Yeah.
well?
On average, this one has been worse in the last couple of months.
Short term, what I think it requires is a course of antibiotics, okay, because of that kind of bad smelling discharge that you're describing. Yeah. Moving forward, I think it needs a referral to have some minor surgery done. Are you allergic to any antibiotics?
Not that I know about.
Okay. Given that this has probably been rumbling for quite some time, I think it may benefit from an extended course of antibiotics. So we'll give you 2 weeks worth. Let's do that referral to the minor surgery GP here. You mentioned something else as well.
Yes. The other thing is I've been recommended by my firm's occupational health to start seeking, diagnosis first, then treatment, regarding stress, depression and/or anxiety.
Physical problems can certainly exacerbate mental health conditions, and there is lots and lots of evidence available to suggest quite strong links between, for example, patients who suffer with chronic pain and who are also suffering from depression and vice versa.
What made them consider that that might be what's going on?
What made them notice was persistent lateness.
Okay. Okay. What are your thoughts?
I would be inclined to agree, not because of the lateness, but I've been finding it really difficult to do anything. I mean, obviously leaving for work is one of those things, hence. But even things that I'm theoretically going to enjoy it's like there's a huge energy hump before I can get going.
Get going. How long have you been feeling that way for?
I'm not actually sure.
Okay.
How can I help you today?
Ever since I was about 14, I've been suffering with migraines on and off. I mainly put it down to puberty. I thought, like, my dad suffered at the same sort of age. Then they sort of seemed to clear up late teens. But I've just got back from holiday a week and a half ago, and I've had 4 in the last 2 weeks.
Oh, right.
And that's never ever, that sort of frequency has never been a case before. So
Can you describe the headache for me?
it always starts off with a flickering in my vision.
Yeah.
And that gradually expands into quite a large blind spot. I lose sensation in my fingers.
Okay.
I think it's dependent on which side the headache's on as to which hand, and sometimes my lips as well.
Okay.
That never used to happen when I was younger.
So what you're describing does sound like migraines, but it's become more severe. And
Yeah.
I just need to get you to do a few different movements with your eyes to start with. So can you follow my finger with your eyes, but keep your head still, and tell me if you get any blurred or double vision. Follow it up. And then all the way down. Any trouble? No? Can you feel me touching you? Is it about the same on both sides?
Yeah.
Yeah. Can you hear this rustling noise?
Yeah.
Down that side?
Yeah.
Yeah. Can you stick your tongue out? Yeah, that's fine. And can you screw up your eyes and stop me from opening them? That's fine. Okay. I just want to have a look at your eyes as well. Would you mind turning the light off for me? So I'm just going to walk quite close towards you with this light. Try not to look directly at the light. Okay, that's fine. I think it would be worth getting an eye test if you've not had one in a couple of years, just to make sure. I suspect that these symptoms are related to the migraine, though, that you've described.
Yeah.
I think at the moment it would be worth giving you the preventative one. Do you mind just popping the light back on for me?
Yeah, I thought it was a bit dingy.
Okay.
Thank you very much.
Take
Cheers.
care then.
Have a good day.
Bye-bye, you too.
How are things like sleep, appetite?
Sleep is less than 8 hours a day, probably 6 on average, and I am way overeating. I'm always hungry.
Yeah. And then stress?
Honestly, I don't know how I would tell how much frustration and anger is a reasonable response to life. Those are the two emotions I'm really capable of feeling all the time.
Yeah. Any reasons why you're feeling that way? Things not quite right at home or at work?
Things tending not to go to plan at work, that sort of thing.
Okay. From the symptoms, I think, Graham, there certainly is that suggestion where perhaps you're kind of not getting enough sleep, you're perhaps not waking up refreshed. It takes you a while to get that oomph and that get up and go. And then having that kind of, perhaps that frustration and anger that you've mentioned, they point towards a diagnosis of depression. But what about other things that give you kind of enjoyment?
I'm a tabletop war gamer, a Warhammer player. And when I can get over myself and get in to go and play, it's fun while it lasts, if you see what I mean. But the minute I'm gone, I've forgotten about it. It's like returning to work after a holiday.
It can be really important to encourage patients to focus on the positive aspects of their life and encourage them also to do exercise, enjoyable activities, because it's been shown that this produces serotonin, which is our body's happy chemical. We fit into the equation here by saying to patients, look, there is the option of an antidepressant medication. And the final option would be talking to someone about your emotions. And so talking to someone who's trained and would sit down with you and go through how things are feeling and try to work out where perhaps this has all come from. And that's Talking Therapies. It's a free service on the NHS. What do you think about that?
Obviously, I'd want to start at the less drastic end and move upwards, so we reserve medication for option 3.
Yes. That would suggest to me that perhaps Talking Therapies could be a really sensible approach for you. I'm going to provide you with contact details for the Talking Therapy service, and we always say to patients, look, it's over to you to contact them.
Yeah.
We will be arranging a follow-up appointment for you after today, just to see, well,
what's changed?
Yeah, where are we? What's changed? What's different? I'll ask my admin team to arrange that appointment for you. There we go, Graham. A few ways in which you can contact them and the kind of things they offer there. Thanks for coming in.
Thank you.
All right, we'll see you in about 2-3 weeks' time.
Thank you very much.
Take care.
Oh God, whose hair's that? Is that my hair? On the back of your chair? That is disgusting. Is that my hair? Can you see it? I think it's mine. God, I'm molting. my hair's falling out. Oh God. I'm gonna be bald.
Hello, come and have a seat. How are you today? Tell me, how can I help you? Hello, come on. Yeah, you come in. Yeah. Mums are allowed, yeah, if they're okay with it. Okay. Tell me, how can I help you?
I've been told to come to see because I noticed when I had my 24-hour ECG, they found some problems with my heart.
Let's have a look. Okay, so you had an EEG, which was abnormal.
Yeah.
Confirming the diagnosis epilepsy, you were put on levetiracetam,
Yeah.
Keppra. Yeah. Is that helping you? No more seizures?
So far.
So this is basically a first-degree heart block, which we tend to see in some patients. I'm just going to check your pulse, if that's okay with you. Thank you.
I have noticed that the more she is tense, the more
Seizures?
seizures.
Do you think it's right?
Yeah.
What are the triggers you feel that you...
I don't know, like 1 minute I'll be fine, the next minute I'll just be laying on the floor and then I'll lose consciousness as well. And then I'll come back around.
How you getting on?
Well, some days better than others.
How's your anxiety?
Calming down. I'm a little bit calm today, but I've had a bad morning. I say really bad.
My anxiety attacks are coming back.
Okay. And tell me what happens when they come along.
Well, I'll just go all hot and cold, sweats and that, and I'll just start panicking. And that, and it's really bad panic and all, like I can't breathe hardly.
Sometimes I feel like I'm anxious.
Yeah.
I get really like agitated, like really like panicky for no reason. I like my mood just changes. Next minute I could be all like bubbly, and the next minute I'm having like a come down and I'm like taking it out on people.
Think there's a bit of light at the end of the tunnel?
I hope so, yeah. I really do, yeah.
Well, that's better than where you were.
Yeah, absolutely, yeah.
Is that what's causing you the increased anxiety or panic, or is there any
Not really
underlying...
sure.
Yeah.
I think so. Yeah.
Are you socially very anxious,
Sometimes, yes.
being at work
Yeah.
and things like that? Yeah. Let's have a look.
So I was put on quite for Panadol and
She put quite a lot of it.
Yeah, I can see that. Gabrielle stopped her antidepressants thinking that they were the cause for her seizures, but later it was confirmed that she had epilepsy and was started on anti-epileptic medications. Now that we know that these medications are not the ones that are responsible for your seizure, we can restart one of them called citalopram at a very small dosage of 10 milligrams. That is used for anxiety as well as depression. You could see how it goes with that.
Okay.
Prescribing in multiple medical condition can be a tricky issue. It's not an exact science. It is based on what's out there in terms of the research evidence and the patient experience and our own experience of having prescribed in the past. It's a triangulation of all these three that would help us issue the right medication to patients. There is another medication called venlafaxine. The mention here is use venlafaxine with caution in the history of epilepsy. So most of the antidepressants, or perhaps all of them, will have that kind of effect. But you haven't tried that.
Yeah.
That's something that I'm happy to issue that for you and see how it goes. It's once daily, and you can see whether that will help you. Yeah? Okay.
Thank you very much.
All the best. All right?
Thank you.
Take care.
No one speaks Polish.
Oh, I got told that I look Polish, but I don't speak it.
Very helpful.
Oh, just letting you know.
John Condomiti, please. Hi. Hello, come through. Have a seat.
Right.
Hi, how can I help?
My problem at the moment is for the past few days, it felt like I had trapped wind right up in quite a large area. But now, even though it's not as great, I still can't reach the top end of my breath. It's hurting all on the right.
Okay. And what do you do for a living?
Construction.
Right. I was looking at your T-shirt thinking...
So, no, I'm qualified as one.
Right, okay. Going to put this on your finger to start with. Have you had a cough or cold in the recent few weeks? No, you've otherwise been quite well.
Health-wise, I'm pretty good.
So listen to your chest now. Point to me where it was hurting you when you took a deep breath in. In fact, can I lift this up when you do that so it gives me an idea?
Yeah.
All right?
Right.
So take a deep breath in and out. Whereabouts? In there. Okay, you can relax now. Well, I'm just going to tap on your chest now. Listen to your back. Do the back now. That's great. Okay. So, is it tender when I push on the chest wall here?
No. So I'm thinking that it might have been a rib.
When I push on those ribs there,
Yeah.
is it causing you any pain? So the pain is when you take a deep breath in, it seems to be catching, is that right?
Yeah.
So do that one more time. Okay. It almost sounds like what you have is something called pleuritis, where something is rubbing between the membranes that cover the lung. Now, why this has come on now is very difficult to pinpoint. I mean, I did do a check and your lungs sounded clear. Your oxygen levels are really high, so 99%, which is good. So, you know, one of the other reasons we tried to exclude is something like a blood clot, but that does not seem to fit with you. Obviously, if you suddenly find you're really, really out of breath and it's severe pain that's different to what you have now, then you do need to seek medical attention. For the time being, just take it a bit more easy this week.
Obviously, you need that rest, so kind of.
I can give you an anti-inflammatory that's stronger than ibuprofen, or you could stick to what you're taking. What would you rather?
I'd rather get something stronger.
Stronger, okay.
Right, thank you very much.
All right, nice to see you.
Yeah.
Bye-bye.
Takes me over an hour and 2 buses to get here. I'm not bloody well coming back again. That's not it. It's going to take me 2 buses now to get. You know, it's hideous. Once upon a time, I could get the bus outside my door and bring me right round here. Yeah. I tell you, they want us all to die, don't they? I've lived too long. That's the problem.
Well, you're looking good then.
Well, as I say, while I've got clothes on. As they start coming off, you see the years, I get worse and worse and worse, I can assure you.
Safi, she's been quite poorly.
Yes.
Really bad sore throat.
Yes.
Her runny nose just started today, temperature.
Yes.
Just coming down with paracetamol, but I just wanted to get her checked out. She's coughing constantly.
Of
She's
course.
kind of,
No worries.
I don't know if it's tonsillitis or what, I'm a little bit worried.
No trouble, we'll get it all checked out. I'm just going to jot some of these things down. I have to ask, Mum,
Yes.
have you come this way for me? That's fine. Pop your finger in there for me. Finger in there. Lovely. Let's put that into your ear. Have you had this done before?
Yeah.
Lots and lots and lots. All right. Any earache?
No.
Okay. Open your mouth as wide as you can. Very good. Okay. Stay there for a minute. Press here. I want you to tell me if there's any soreness here. Is that painful?
Yep.
Is that very sore? Do you suffer with tonsillitis?
I have before.
Stand up for me. And just pop your jacket off for me. And if you turn around to your mum, nice big breaths in and out. And out. And again. Lovely. Grab a seat for me. Okay. Good things, guys, good things. So, your temperature's perfect.
Oh, good.
Your heart rate is perfect. Your oxygen level is perfect, so all those are good things. Okay, your chest is clear. You've got good air entry on both sides. No crackles on your chest, which is good. The throat is red, but there's no pus at the back of the throat, which is important. Your glands are up, so I can feel that's what's sore.
Yeah, she did say.
The likelihood by far this is a viral infection. Antibiotics won't work, unfortunately. There's no magic cure. 7 to 10 days. Important things when you get a temperature, paracetamol, bring your temperature down, plenty of fluids, and time. Does that all make sense?
Yeah, it does. Okay, that's good. I probably have the rest of the day off today then. Thank you very much.
No
Doctor.
trouble, no
Thanks.
worries.
Bye-bye.
Bye-bye now.
I'm telling you now, girls, and I'm telling you, I would not order myself a triple vodka.
So who ordered them for you?
Pam.
She's naughty.
She can drink that much, I can't.
Well, I don't know, she gets pretty drunk herself.
Yeah, but she came in on Friday and she said that she was rough. Mate, she had her hair done, makeup, everything. I came in, right? Hair was like this. I had Thursday night's makeup on. Still, I was rough.
come in. Come and take a seat.
Oh, it's a big room.
Yes, come in. How can I help you, Miss Embry? How can I help?
It's my legs.
Okay, what's wrong?
It's really painful.
Okay, which part is painful?
It's round here.
On the skin?
Yeah.
Describe the pain. Is it a burning pain? Is it a dull pain?
Really sharp pain. I was in agony last night.
Looking on the system, it looks like you've got arthritis of the knees, haven't you?
Yeah. But I've got these painkillers.
Yeah, let's have a look.
I've got them.
Oh, lovely. Yes, so that's your normal medications.
I've got them.
That's for pain, yes. How many of these do you take a day?
They told me last night to take 3 of them instead of 2. But I was in such agony last night.
I've got the documents here. I think one of the doctors said the neighbours saw you coming off the bus and you were crying as you entered the house. And you were complaining of pains in the legs. So they called 111 for you.
And I said to the doctors, I said, I feel like having them chopped off.
Oh, no. No, don't say that, Gloria.
I was in such pain.
How long has this problem been going on for?
For years.
Let's put some gloves on and check your legs. Do you put any cream on your legs?
No.
Because they're very dry. Because if the skin becomes quite tight, that can also cause pain. Can you feel me touching you here?
And it hurts. That's it. That's where it hurts.
Here?
Yeah.
On the front?
And around the back as well.
Okay. Is this the normal size of them? Are they a bit more swollen than normal?
Yeah.
They are? Pop those back on.
I've got some cream.
Yeah. So I might have to give you a stronger cream. And I think the doctors are right that saw you yesterday. You need to take 3 of those tablets instead of 1.
Yeah.
Have you ever had a water tablet before?
Don't think so.
Okay, let's have a look. So what we're going to do is I'm going to give you 1 more tablet today. It will help shift some of the water off the legs, okay? I'm only going to give it to you for a week and then I'll get the nurses to come out and do a blood test. How does that sound?
Yeah, fine.
Okay, so let's do that as well. And I'll give you a special ointment for your legs. Okay? Apply the cream once or twice a day. So the water tablet is 1 a day in the mornings, okay? And I'll get the nurse to come out and make sure things are okay as well. All right, take care.
Okay.
Oh. Let me help you. So the lift is just next door. Take care. Take care, Gloria. Take care. Bye.
Oh my gosh, was you in the other day when her son came in? And she went to him, oh, give us a kiss saying goodbye. So he went and gave her a kiss. I went, oh, give me one too. I didn't expect him to come in
And he
for
went,
one. I was like, oh.
How old is he? 17. Oh, I bet he did. Of course he went in for one.
Oh, I need candle. Hello. Come through. Have a seat.
Mr. has a very bad cough and a very bad sore throat, it seems.
Okay, tell me, when did it start?
Oh, I've had it on and off for a week now.
Okay.
We're struggling to feed him, basically.
Okay, and how's the breathing?
He's got a floppy windpipe, so his breathing's going to be erratic, and he's had a viral ever since he's been 6 weeks.
So there's been no change in his
No
breathing?
change at all.
Okay. And how long has he been feeding the way he's been feeding?
It's been about a week.
Any temperatures at all?
No, I don't think you've done smelly. I can smell it. Thank you, son.
Is he having wet nappies? Yes. Okay. All right, let's check him over.
Yeah, that's fine.
We'll start off with his chest and then we'll do his temperature and
Yeah, that's
and look at
fine.
his ears and throat and things.
No, that's fine. This little man has everything. He's got that.
This has only just started coming back up again.
Okay.
It did go down a bit.
So quite a big noticeable difference, isn't there?
Just a tad.
It's making you scratch and bleed, isn't it?
Just get off me.
Okay.
Did you have any exposure to daylight at all for hours or anything like that? Not necessarily sun, but just daylight.
No, not at all.
Very inflamed, very angry. I think maybe a touch of some steroids might help with that, some hydrocortisone.
Okay, do you want to bring him over here? Sure. Just leave him the way that he is for the moment and we can check him over. Okay, so just one hand across here and one hand on his forehead here. That's great, perfect. So if you sit him up, it might be easy if you put one hand across here and one hand on his forehead. That's perfect. Oh, little man. Oh. Okay. Does he bring up a lot of his feed?
Yeah. He's on Gaviscon.
So I think what he's got is something called bronchiolitis. It's a viral infection, combined with the fact that he's not feeding as he should be.
Yeah.
And the fact that he's so young. I would like the paediatricians to review him.
Hospital?
Yes.
Who are you looking at?
Hi there, my name's Dr. Deary. I'm a GP from Farnham Road Surgery. I've got a 15-week-old boy I'd like you to review for me, please. Sounds like he's got bronchiolitis. My main concern is Mum says he's not been feeding. On examination, he's afebrile, respiratory rate of 48, heart rate's normal. Thank you so much. Bye. Right, there you go, Mum. All the best. Take care, right? Like I said, it's just to be cautious and for monitoring. Let's see how she gets on, all right?
Tell me, Phil.
I tell you what I did like, and it was a vegetarian dish. It was halloumi. The halloumi in the wrap. That was quite nice when I ate in there once.
Halloumi from Nando's?
Yeah.
They're famous for chicken, and you go and have vegetarian.
Yeah, I'm not a big meat eater.
Oh, I am. I'm so greedy for meat.
And they don't do fish. So,
butterfly chicken, sweet potato.
Come in. Take a seat. Is it Brotham? Browham?
Rome.
Brome.
Yes, as in Rome, but Rome.
That's interesting. Where's that from? Which part of the country is that?
Lake District.
Lake District. Which part of Lake District?
Oh, there's a village and an abbey. And
Is it an actual village called Brome?
there was, yes.
There was.
I think it's mostly disappeared now.
Where is it in relation to Keswick and Windermere?
Yeah, in the Kendal area.
How can I help you?
Well, I had an X-ray taken on my wrist.
Yes.
Damaged it 2-3 weeks ago now.
Did you fall or something?
Yes. I
Mhm.
fell on that arm, and it's still swollen up. I've had it X-rayed, and the result was supposed to be in today. That's why I've come. It's still very sore. I
It
can't put
says
weight on it.
no acute bone injury demonstrated.
That's right. No fracture, she said.
There is significant degenerative change, which basically means arthritis. Okay?
All over. It's still very painful. I can hold an empty glass, but a full one, no.
Just relax.
Because the arthritis doesn't help.
Yeah. When we pass 21,
Yeah.
things start to heal a bit
downhill, yeah.
slower.
Yeah, I
And my hunch is that did you fall?
Yeah.
Yeah.
And I felt like
That you've I mean, I suspect it's a lot of soft tissue injury. It's not bone.
not bone.
And it's actually just a nasty sprain. I tell you what, I'm going to give you some naproxen for a couple of weeks, which I want you to take with food,
Yeah.
a small dose, because you are 88.
Probably time I departed this mobile mortal.
Well, I don't think that's true. For one thing, you're still compos mentis, you know. Aging is not easy.
No. No, tell me about it.
Because we've got healthier, the course of your life expectancy has done this. I mean, when you were born, you know, I mean, you're a year younger than my grandmother.
Oh, really? My grandmother lived to be 90.
Yes.
Yeah, and my grandfather was about 85.
Were they all Cumbrian?
No, they were from Liverpool.
Oh, okay.
Ah.
Right.
So I'll
Take this
take that.
morning and evening with food, just for 2 weeks,
Yeah, okay.
and then see how you go. Come again if you're worried about it.
If it's no
Okay.
better. Yeah, okay, thank you.
Show you to the door.
The knees, you know.
Take it easy. Bye-bye.
Thank you very much.
Bye-bye.
And we can catch up in 2 weeks' time, see how things are.
Take care. Good luck with everything. Bye.
Thank you very much.
Perfect. Okay. You take care. Bye-bye.
Do you want to go home?
Yeah.
Yeah.
Thank
Bye-bye.
you very much.